sorry if everyone's getting very hot. I'm afraid it's my fault. I was getting very cold. No.
It's warmer now. Mr. Javid, we were dealing with the position in summer of 2021. I just want to ask you about a discrete topic that arose at that time. At that stage, a high prevalence strategy, high prevalence of COVID-19 infection, was being considered and pursued. Is that right?
I'm not sure exactly what you mean by high prevalence strategy.
Well, if I can assist, on the 20th of July, a paper was presented to the COVID-O group. That's entitled High Prevalence Planning the Summer Response. And that sets out effectively moving through the major cross-departmental risks of high prevalence. So this is the policy that's in place in the summer. NPIs have been relaxed at this stage, Plan B yet to come, and so it's effectively living with a higher incidence of COVID-19. My question in relation to that aspect is that various patient representative groups, Long COVID SOS, Long COVID Support, Long COVID Kids, had written letters to you outlining concern about the move to step 4 at that point, slightly earlier in the pandemic. They complained and made representations to you that long COVID was being ignored in those policy-making decisions in relation to a high prevalence strategy moving forward. It was barely mentioned in the roadmap out of lockdown, and they asked that that be considered in policy. You may also recall that they were participants in Cabinet Office discussions and cross-Whitehall groups at the time. There were round tables, and we've heard a little bit about those already, so I'm not going to go there in any detail. But given at that stage that there were no pharmaceutical interventions, and indeed to a large extent remains the position now to treat long COVID, was there a conscious decision to accept the increased incidence of cases of long COVID arising from that corresponding increase in infection from COVID-19?
I think that it was well understood that as we start removing the NPIs, albeit keep some of them in place, but start removing a large number of the NPIs, that I think what the words high prevalence then referred to is that there would be, at least for some period, an increase in the number of infections. I think that was understood. And then to addressing your point, Ms. Cecil, around long COVID, it would mean, given that to get long COVID you have to be infected in the first place, that as infections rise, there would be a rise. No one, I think, at the time knew to what extent, perhaps, but there would be a rise in long COVID, at least had to be considered.
And to what extent was that factor taken into account when reaching those policies? Relaxing restrictions, not maintaining testing, and various other options.
My view is that I think overall it was taken into account for a couple of reasons. First, I'd say that it was well understood, certainly by me, and I think the key people making the decisions, including the Prime Minister and his office, that having NPIs in place were not a risk-free option. There were costs that come with NPIs. So, for example, obviously I was concerned about health more than anything else, and obviously top of that list for me was the virus and the pandemic. But there were also associated health factors linked directly to the pandemic in terms of, for example, your mental health issues, the fact that people were not able to go to the NHS, for example, in the normal way to see other their other health challenges dealt with. And so I had broader health concerns, but also within cabinet, so more broadly within government, there were understandably, you referred to in our earlier session, for example, some of the concerns around education and children. There were concerns around people being able to sort of go to work in the normal way. There were concerns with other departments. In fact, every department would have some issue. We talked about the transport department. So what the government was trying to do was to take a balanced approach to all of this, but on the basis that the MPIs should not exist a moment longer than they are necessary, and if the evidence supported it, we have to find the time to remove the MPIs. And if I may add, one thing I distinctly remember at the time, and it came up in a number of discussions with the advice that I was receiving, and I'm sure the Prime Minister was receiving from the CMO, the CSA, and others, was that when we asked about the timing of removing these MPIs, and does it sort of, what do they think, and does it make sense? One thing that was said a number of times is that there's no perfect time to remove MPIs. There never will be. But if you are going to do this and consider it, it's much better to do it in the summer, because the virus likes the winter. People are more likely indoors in winter. New variants have typically appeared in the winter, although we couldn't be sure of that, of course. And children are off school in the summer, so summer was a better time versus winter to do it. And if you don't do it in the summer, remove your MPIs, some of the MPIs, then you are likely left with those MPIs going into the winter. Then it's too late, and therefore you have this really extended period MPIs, and then all the costs that come with that as well. So those are all the sort of factors, the factors that went into making that decision in July 2021.
And just picking up on that, that was when the vaccine rollout was also going to be continuing to take place throughout that period.
At a very strong pace.
So in terms of a policy decision, was it considered that was a trade-off worth making when taking into account those other issues that you've identified, whether it be schools, mental health, and so on?
Yeah, yes. In what I would just broaden that a bit is that to govern is to choose, and ministers are always making trade-offs. Every decision, pretty much, I ever made as a minister is a trade-off, and this is a decision that was made for the reasons I just articulated. But it's important that we had obviously what we had then were unlike the previous summer, the year before, we had a vaccine. Millions of people were getting vaccinated, many of them now turning up for their second vaccine. We had a lot more treatments for COVID. I understand what you said, and you were quite right, Ms. Cecil, about treatments. I think you said specifically for long COVID. It was still very much early days of the virus then, so I think it was hard to make a determination around the long-term impact of infection when we had the sort of short-term experience at that time. But there was a lot more testing. There was a lateral flow testing. There were the test, trace, and isolate rules, and there were the international border rules. So it was, yes, a number of MPIs being removed, but also a number of sort of protections and precautions were being kept in place as well.
May I just ask you one final question in relation to long COVID, and given that was the choice taken, why was there not, at the same time then, a public awareness campaign warning people of the potential risks, specifically of long COVID, so that people were aware that, albeit that they may not have a severe reaction or to the infection, for example, people in low-risk groups for the actual COVID infection itself, may nonetheless still contract long COVID?
Yeah, I think that, I mean, certainly from the health department, and also, if I recall, many of the things I was saying at the time, including but not just in Parliament, but in media appearances, in long COVID was something I was very much aware of and very concerned about. So, for example, during that summer or around about that summer, there were a number of decisions that I made around long COVID to, for example, to increase the funding available for research. I think it was 30 million, I increased it to 50 million.
I can just pause you there, though. The question I'm asking is specifically about a public health communication strategy, a campaign so that people were aware of the potential risks of contracting long COVID, and so that they could take their own precautions if they so chose to. Was any thought given to that, to a public campaign?
I don't. So if you ask me, do I recall specifically a discussion around a campaign on long COVID? I don't. I recall many discussions that included the issues and concerns around long COVID specifically. And that is why, for example, I increased the research spending, I increased the number of assessments.
As I say, I understand that, Mr. Javid. My question really is very much focused, and I think you've answered it. The short answer is no.
I don't remember thought being given to a specific campaign.
Thank you. And then if I can move on through the time, obviously there came a time when the Omicron variant was discovered, first identified in November of 2021, South Africa, and then, of course, you were updated in your role by the Chief Medical Officer and others. Just dealing with that for a moment and moving through that, at that stage, the advice was that it was highly infectious.
Yes.
It was unclear if the vaccines would work for this particular variant.
Yeah.
But at that stage, severity was unknown in terms of morbidity and mortality. If I can just call up Sir Patrick Valence's notes at page 529 for a moment, please. just want to deal with some of the discussions that were taking place in late November 2021. NERVTAG and SAGE have met and discussed the position. This is the 26th of November. He records, how bad is it? We don't know. JVT, Jonathan Van Tam, says he's never seen NERVTAG so rattled. We need a policy. Continues onwards. Number 10 meeting. Prime Minister very down about new variant, exasperated. Afterwards, number 10 says they're at war with number 11. If I can just ask you about that very briefly. Were you aware of any concerns at that point, issues between number 10 and number 11 with regard to COVID?
Not specifically. I thought on most things, my experience was that number 10 and number 11 at that time moved together.
Thank you. And separately, if we carry on, and anything that Javid says, they assume is wrong. What was your relationship like at that point with number 10?
It was getting testy because of Omicron. And that, as you say, this is dated, so 26th of November. My first, so things were moving very fast. My first briefing I received on Omicron, your full briefing, was on 24th of November. And I was very concerned by what I had heard and what the experts had told me. Just to pick up a point, Ms. Esser, you said on the vaccines, it wasn't, so as you said, they said it was much more infectious from the evidence they had at the time, and clearly that turned out to be the case, so much more infectious. And also, what was in my mind then was that I knew that each new variant had, so when we had Alpha, Beta, Delta, they had been much more infectious than the other. And now this was much more infectious than Delta, which was already highly infectious. I was deeply concerned about that. But also, with regard to the vaccines, what I was told was that not that the vaccines didn't work, they may not work, was that they may well be much less effective. Right, so there'd be an effectiveness, but much less, and even a sort of a 5 percentage point decline would be significant if you've got a lot more infections. And then the point about severity is that we couldn't be sure on the severity. Is it less, more? At the time, there was no data. So I was deeply concerned, especially about the infectiousness. And I wanted us to take action, and some action, and take it ASAP. And I did start to take action straight away. I think the next day I announced some travel restrictions. I made a statement in Parliament on the 26th. And
I'm just going to interrupt you there, Mr. Javid, because we are going to move through some key moments. Yeah. But there are some structural issues that I just want to deal with in relation to Omicron. And of course, we've got your witness statement, which sets out the chronology. Yeah. So just to very quickly summarise, throughout that November-December period, SAGE's advice was that the infection rate was rising rapidly. Yeah. With regard to that, they were advising that certain actions potentially be considered to be taken. You were, as I understand it from your witness statement, in terms of some of those frictions that were arising, were certainly more on the cautious side and wanted some additional restrictions put into place because of your concerns about Omicron. Is that right?
Yes.
Now, if I can just go through. So on the 8th of December, Plan B is announced, is implemented, comes into force, I think, on the 10th of December. Yes. If I can just call up some meetings very quickly now. Page 555, please, of Patrick Valence's diaries. There was a meeting on the 18th of December of 2021. And that records that you were not invited to the meeting yesterday. I'm afraid it must be a subsequent. But in any event, what it records is that you were not invited. And indeed, what we see again on the 31st of December of 2021 is a similar meeting taking place with discussions about Plan B, discussions about what to do, in fact, indeed, in relation to your advice also. But again, it's recorded it's bizarre to have this meeting without the Secretary of State for the Department of Health and Social Care. Were you aware of these meetings taking place at the time?
No.
And when did you first find out about them?
Yesterday, when I saw this extract.
And why do you consider that you were not invited and present at those?
Look, I can't be sure, because obviously, there's decisions for others. One thing I can tell you, if it'd be odd to, these, obviously I don't know about this meeting, I wasn't there, but it sounds like, just from this extract, and I can only go on that, it sounds like it's an important meeting. There's very senior people there, and they're obviously discussing the Omicron crisis. And my central job and role was to respond to that, and so I was spending basically every minute of the day doing around that time, and not to have my input and therefore the input of my department, and that includes not just obviously UKHSA, the CMO, but NHS. Because NHS obviously was a huge factor in this. We would not want to see our hospitals overwhelmed. So I don't know why I wasn't included. You'd have to ask the former Prime Minister.
And again, at the same time, the advice that you are giving, or your views at the time, certainly on the 24th of December, for example, is we need to prepare for a massive increase in cases, but hope it doesn't happen. Yeah. Obviously, so planning and preparation. Yeah. Prime Minister is then recorded as concluding that there's no overwhelming case for doing anything. In relation to planning and preparation in the event that there was a subsequent wave, aside from vaccines and your role in terms of the NHS, were you aware of any other planning taking place at that point?
You mean what, outside my department?
Outside of your department, and considering the use of MPIs or any other measures?
I was not aware, no. I mean, I wasn't aware of any other planning taking place, to answer your question specifically, but a bit more detail in that, we had already, so I know you started with a Plan B, which was implemented, I think, on November the 8th, but on the 29th of November, so that's within days of me learning about Omicron, I'd already announced in Parliament a set of NPIs around PCR tests coming in, 10-day isolation rules for contacts, and that, face masks in shops.
I appreciate that, Mr. Javid. Yeah. We're talking about what you're advising on the 24th of December.
Yeah, by then, having learnt a lot more about Omicron, my advice was to look at taking further measures. That advice that had come from me and my department based on the expert advice I was getting. And there was a cabinet meeting, I can't be sure, I want to say the 20th of December, where there was the Prime Minister, aware that I wanted to go further, wanted to seek the Cabinet's view. And when we had that meeting, I recall the only people in the Cabinet that were supporting what I was saying about going further were Michael Gove and Simon Clarke.
Thank you. Now, I just want to turn to another topic, which really is coming out the other side effectively and dealing with the living with COVID strategy. So going into now 2022, just very briefly, you set out within your statement in some detail that there was a disagreement with Treasury in relation to funding and apparatus, effectively the tools as you see them, in relation to a pandemic, particularly in respect of infrastructure around testing, scientific research, and so on. And you considered that funding ought to be maintained. What you state in your statement is that as a consequence of that, the Prime Minister required further cuts to the health budget if that infrastructure was to stay in place. Is that right?
That's correct.
And did any of that infrastructure ultimately end up staying in place?
Not to the extent I wanted it. I was like the Prime Minister, I was keen that we find clearly a way to live with COVID. Omicron wasn't over, but I think by the time we were putting together living with COVID strategy, both infections, hospitalizations, and deaths, that had all started significantly falling. The booster campaign, which I spent a lot of my time on, I know we're not talking about vaccines, but it made a huge difference by that time. So it's significant in this decision making, in that I think within 6-7 weeks we had something like 30 million people boosted, which was faster than any other country of comparable size. But on this specific issue, I felt that as we now remove a lot of the restrictions, which I was keen to do, that we must have a capability in place to detect any future variant or perhaps even a future virus with a new pandemic, but to have better surveillance and also to be able to surge support and protection very quickly. And so I wanted more lab capacity, more scientific capability, some random testing to keep some of the mobile testing units. I wanted to continue some of the wastewater testing and a stockpile of lateral flow tests, for example. So these are the kind of things I wanted. I was only able, in the end, to secure a small portion of all of that. And also, for example, I wanted to keep the government's commitment to the Centre for Pandemic Preparedness.
I was going to come on to that in due course.
Okay.
That was announced. There would be this Centre for Pandemic Preparedness.
Yes.
And what happened to that?
That was announced before I was Health Secretary. I believe it was when the UK was hosting the G7 in Cornwall. So I think that would have been December 2020, if I'm not mistaken, but around then. And the UK had made this commitment, I thought rightly, to have this, as it sounds, a Centre for Pandemic Preparedness, which was focused on nothing but pandemic preparedness, working with UKHSA and others. And I thought it was vital in terms of lessons learned.
Indeed.
And I pointed out to the Prime Minister at the time and his team that we are not going to be able to have this because there's no funding for it. Indeed, the funding that was offered for UKHSA was the same as what it was funded per annum pre-pandemic.
Indeed. If I can just take you back, though, to the Centre for Pandemic Preparedness.
Yes.
In terms of that,
yes.
Did the Prime Minister continue with that plan, or did he abandon it?
No, he dropped the plan, and he decided we're not going to have it, let's drop it. But he asked me not to say anything about it publicly, and let's just wait and see if people notice, was his attitude.
So let's stay quiet and hope it disappears.
Well, let's stay quiet about dropping the Centre for Pandemic Preparedness.
Final topic, Mr. Javid, very briefly. You've covered it in quite some detail within your witness statement, and that's why I say I'm going to touch upon it very briefly, if I may, and that's that of inequalities and health disparities. And within your statement, it speaks of a number of different initiatives that you undertook in your role as Secretary of State throughout that pandemic period, one of which was a review into inequalities in respect of the efficacy of medical equipment on the grounds of race, looking particularly at oximetry, the use of oximeters, and so on and so forth. That consultation ran between August 2022 and October 2022. Has that been published?
My understanding, it has not been published.
And just dealing very briefly in terms of future recommendations, what do you think could and should be implemented to improve equity for future pandemics with respect to health?
So, can I just be clear? When you say equity, do you mean sort of
to address
health disparities?
Indeed, to address those disparities that arise in a pandemic.
I think a lot can be done, and the pandemic clearly sadly hit people from deprived communities more. It's very unequal in how it affected people. By and large, people that were sort of working people were hurt a lot harder than middle class people that could put themselves in their homes and order their food and things like that in lockdowns and that is not surprisingly, in my opinion, that's not unique in terms of health disparities. Typically, people living in deprived areas or neighbourhoods and things are hit a lot harder.
We've heard a lot of evidence about that, Mr. Javid, already.
And so that was your answer to your question. What could be done? I thought the whole approach required a cross-government strategy, because it's not just a health department that can deal with these issues, and that is why within months of arriving in the department, because this issue was so important to me, I commissioned a white paper to the development of a white paper on health disparities, and I even took the one part of PHE that was split was called OHP, the Office of Health Improvement, and I changed its remit to the Office of Health Improvement and Disparities. But the white paper was a cross-government piece of work that my department did, and it's an extensive piece of work. We talked to every other department of government, a lot of arm's-length bodies, civil society bodies, put together a really detailed analysis of what could be done to combat health disparities. And by the time I left the department, I would say it was 99.9% done. It was virtually done. We were just looking for a slot for publication, but it was never published.
And just one, and hopefully this can be answered very briefly in short, one potential possibility or solution that has been suggested is the creation of an equality department with a Secretary of State for Equalities leading on that cross-governmentally. Is that something that you could see working or not?
I don't know whether it requires its own department. There is, of course, as an Equalities Minister, I was for a short time the Equalities Minister as well, but I do think it needs a specific focus and a dedicated minister. So when I was Equalities Minister, I was also the Secretary of State for Culture, Media and Sport, and I think it would have been better to have a dedicated minister to that role. If there's one more thing I may say, Ms. Hess, just on equalities, health quality generally, but specifically in pandemics, you referred to the pulse oximeters. And that is something I'd read about, I knew about before I was Health Secretary. I was deeply concerned about it. That's why I commissioned the independent review by Dame Margaret Whitehead, the one that still hasn't been published for some reason, into looking into medical instruments and how they work on people of all races and actually in both genders as well, all genders. And one thing I wanted to pursue that I discussed with my counterpart in the United States at the time was that I felt that if the UK and the US had a new set of rules for procurement of any medical instrument to require that it must be demonstrated that it works for all races, and it has been something the manufacturer has actually thought about, then between the UK and the US, with their US's purchasing power, our procurement power as well, effectively all manufacturers of this equipment globally would start to follow this new standard. So I was, but before I could do that, I wanted this independent inquiry to see if the evidence backed all this up. And so I do think there are things like that can be done that would make a huge difference, because I was really taken back by some of the things I learned as Health Secretary. For example, that I think around a third of people in ICU units in 2020 with COVID. So the most affected, the most seriously ill, were from ethnic minority backgrounds, which is hugely disproportionate to the people from ethnic minority backgrounds in the general population. And I think that medical instruments, amongst many other things, has a big issue, or a big role to play in that.
Thank you, Mr. Javid. And as you'll be aware, there will be a further module that no doubt will be looking at those matters in due course. My lady, that concludes my questions. Just
before we go to Ms. Heaven, could I just ask? By the sounds of it, Mr. Javid, one of the lessons to be learned is to resurrect your idea of a Centre for Pandemic Preparedness.
Yes. Well, it wasn't my idea. It was the Prime Minister's idea. I happen to agree with it.
Right. Any other lessons to be learned?
Yes. I think there will be many lessons to be learned. I think that in terms of cross-government working, I think there can definitely be improvements in that. We've touched on it in this evidence session, I hope, in a couple of examples, but I think there needs to be the better systems put in place to get all government departments working for when you have a single goal. And I've seen where it can work. You know, when I was the community secretary, I was determined to do something like rough sleeping. We had a cross-government group, and it had prime ministerial involvement, and it could get done. So I think that can happen. And then one final point I'd make when my lady, you asked me that question that comes to mind is NHS capacity and NHS capability. As you know, my lady, a number of countries, they took different approaches. There were a lot of similarities, but I think that in responding to a pandemic, that your available health capacity has a big is a big determinant of how you respond to the pandemic. We don't have many beds per head in the UK. In England, for example, it's around 100,000. If you look at countries like Germany, France, other comparable countries, they have more than double, triple, sometimes quadruple number of beds that we've got. Similar for ventilator units, ICU units, doctors and nurses per head. And I think capacity of the NHS is an issue, and this has been a long-running issue under successive governments. And I think the NHS model needs to be looked at, and I've talked publicly about this, and I think we should have a royal commission on it and try to get government sort of political agreement on a new way to provide the NHS with the resources it needs. But I think NHS capacity is absolutely key to dealing with the next pandemic.
Thank you very much, Ms Heaven. I don't know if you can see Ms Heaven round the pillar. Can you see?
Yes, I can.
Good afternoon, Ms Javid.
Hello.
Mr Javid, I'm over here. I represent the Covid-19 bereaved Families for Justice Cymru, and I just have three very short topics. So the first topic is going back to those weekly meetings that you set up when you came into post in June 2021, and it's a very discrete issue. Can I ask, was advance notice given for these meetings by way of an agenda, do you recall? And if so, how long in advance?
May I just ask which weekly meeting are you referring to?
This is your witness statement, paragraph 77. You say, I set up
with the devolved nations.
Oh, with the devolved nations?
Yes,
I'm sorry. Yeah.
Sorry, I thought it was obvious, but...
Oh, sorry,
just to be clear, I represent the Welsh bereaved, so I'm asking now about issues touching on the devolved administration.
Yes.
So the weekly meetings with the DAs, you said this was not something your predecessor did on a regular basis. And what I'd like to know is, do you recollect whether there was advance notice in the form of an agenda for these meetings regularly, and if so, how long in advance would that have been provided?
Yeah, there was generally there was advance notice, and I think in my very first meeting, I said to my counterparts that we would have meetings on a weekly basis, and I'd said that I'd try to do those every Friday around 5 o'clock. If I can't do it on a Friday, I do it at the same time on a Thursday. But we did agree that because things are very fast moving, something might come up that doesn't allow the meeting to take place at the exact time. So during the week leading up to that, the Thursday, the Friday, the timing of it would be confirmed. For these meetings, we would have an agenda, and I would obviously, my department would input into that agenda, but so would the devolved administrations, and they would give me very sensibly advanced notice of things that they may wish to raise in that meeting. And then also, finally, in every meeting, we would have basically any other business. And so if there's something that someone wanted to bring up, again, because things were fast moving, we could discuss those towards the end of the meeting.
Thank you very much. Second topic is public health messaging and concerns around a unified approach with the devolved administrations. And it's just really to see to what extent you might be able to assist with this, appreciating when you came into post. Now, you've explained this morning that you recognise the importance, where possible, of coordinating with the devolved administrations. And I think, as you said in your words, you'd recognised at least that there were huge issues of public confidence if we can all be seen to be working together.
That's right.
You may be aware that there have been concerns raised before this inquiry, in part in writing, by the First Ministers for the devolved administrations. And one of the concerns relates to a lack of clarity in public health messaging by the UK government about the geographical application of their decisions. And I think it's probably fair to say that lots of these concerns were largely being raised during the time of your predecessor. But there is one document I'd like to ask you about, so if we can pull it up, and it's a COBRA meeting of the 10th of December 2021, and it's 83854, and there we have it on screen. Can you see it there?
Yes.
So we can see 10th of December 2021, 3 o'clock, and you're present there, and you can see also, can't you, Mr Drakeford, Nicola Sturgeon and Michelle O'Neill from the devolved administrations.
Yes.
I want to ask you about page 5, please, if we scroll down, and it's paragraph 17 onwards. I'll read it out. Here we have a contribution from the Director of Communications, and they said they were adopting an aligned approach where possible to ensure messaging across the United Kingdom responded to the emerging picture. That communications teams across the UK needed to accurately reflect policy changes by each nation. And then it goes on about the cross-autumn UK issues. And then just for completeness, at paragraph 18 over the page, we see an intervention from yourself where you're stating it's important to work together on the response to Omicron. Consistency across the 4 nations is important.
Yeah.
What I want you to focus on, though, is paragraph 17 and those words in the middle, that communication teams across the UK needed to accurately reflect policy changes by each nation. Just thinking about that now, do you understand that to be a reference to this issue that I just asked you about a moment ago? So the territorial scope of policies not always being adequately explained in government communications from UK government, and that being there a reminder, certainly in December 2021, that needed to be improved.
Yes, I think this is really calling for it to be improved, and I think what that is getting at least my understanding of it, is that many of the responses to the pandemic, particularly the NPIs, were devolved. And whether it's Wales or Scotland for that matter, I think they might have a different set of NPIs, and that certainly was the case during Omicron, certainly for most of that period. And it was important, I think, to respect that there might be differences of approach, but that there was coordination in communicating that, because otherwise it might be very confusing to the public.
And do you recognise that concern that I've just suggested to you about
Yes.
the geographical reach of decisions not always being made clear?
Yes.
By UK government?
Yes.
Final topic then. I'm moving forward to the end of 2021, and here early 2022, and it's discussions on international travel with the devolved administrations. I'm not so much interested in your views on this topic. It's more really the process for engaging the DAs on this important issue. So the context is there came a point when we see differences emerging between the nations in relation to international travel. For example, Mr Drakeford, First Minister for Wales, and on behalf of Wales, was advocating at this time, we understand, a more precautionary approach to the UK government opening up borders. And we have, I won't bring them up, but we have a series of letters Mr Drakeford writes to the Prime Minister, and it's responded to by Grant Shapps, and this is early January 2022, and I think you're copied in, but you're not the one responding, to be clear. So here we have very sensitive discussions and indeed disagreement between the UK government and the Welsh government about the important matter of international travel and control of borders, and it's taking place in writing. Now, it might be suggested that it's surprising to see such important matters being discussed in this way in writing. And of course, we know at this time the JMC system wasn't operating. We know that there were significant periods of time, I think perhaps before you came into post, that COBRA hadn't met. And we know that concerns were being expressed by First Ministers about a lack of a formal structure for them to communicate regularly with the Prime Minister. So my question is this: are you able to offer any perspective on whether, certainly from your time in office, whether you considered there was in fact suitable machinery or a workable system in place for conducting regular, high-level intergovernmental meetings between the First Ministers of the devolved administrations and the Prime Minister?
Yeah, it's... I can obviously certainly talk about what my department did at my level with my counterparts in the devolved administrations. And as we referred to, I had sort of regular formal meetings, irregular contact in the sense that they were free to contact me anytime I could contact. So I felt that those relationships at my level were very constructive. They worked well, and I certainly I learned from my counterparts as well. But I think your question was more
focusing at the high level. Yeah, and did you have any sense?
First Minister, Prime Minister level, if that's what you're asking me.
Yeah.
I mean, I wouldn't really fully know. I don't think I would be able to fully answer that question, because what was going on at that level, I really wasn't involved in, and because I was dealing with things at my level, my departmental level, if there was an issue at the sort of leader of government level, I wouldn't necessarily have been involved. Other than what I will say is that when I had my weekly meetings, the issue that you just referred to, which was the issue around the sort of border controls I think in January, you said in January 22, that, that certainly that would have been brought up in the meetings that I had, and at that time they would have been brought up by the health minister in Scotland, which was in Wales, which was Ellen Moore.
Yeah, as I said, I'm not asking you about that particular. If we can just finish then that topic, and then I'll be out of time. So, is it your evidence then that these concerns that the inquiry's heard about, this lack of a regular forum for communicating at that very high level with the devolved administrations, was not something that you were aware of being communicated, certainly during the time that you were in post?
No, I wouldn't. No, there were I can think of letters that I might be copied on. That, so, for example, I think when you asked me about that COVID meeting in December, whatever the date is just now, the COVID meeting with the First Ministers that Michael Gove had chaired, I believe that came about because of a letter that was sent to the Prime Minister, I think by the First Minister of Scotland, if I'm not mistaken. And then the Prime Minister asked me to respond to that letter, which I did. And then this COVID meeting was held. And I can sort of sense from the fact that the letter went to the Prime Minister, I had to respond, and then Michael Gove chairs the meeting, not the Prime Minister, that there's probably some tension at that level. But so when you say not aware, I could sense some tension, but it was not something that I regularly came into contact with.
Okay, thank you very much.
Thank you, Ms.
Thank you, my lady.
Does that complete the questioning?
It does, my lady.
Thank you very much indeed, Mr. Javid. I'm afraid I can't give you a guarantee we won't ask you to help us again, but thank you for your help.
I'd be very happy to come back. Thank you very much.
Thank you.
Thank you.
swear by Almighty God.
I swear by Almighty God.
That the evidence I shall give.
That the evidence I shall give.
Shall be the truth.
Shall be the truth.
The whole truth.
The whole truth.
And nothing but the truth.
And nothing but the truth.
I hope we haven't kept you waiting too long, Mr. Robb.
Absolutely fine, thank you.
Could you give the inquiry your full name, please?
Yes, Mr. O'Connor, it's Dominic Rennie Raab.
Mr. Raab, you have kindly prepared for the inquiry a witness statement, which is on the screen now. We can see it bears your name. It's dated both in the top right-hand corner of the first page and at the last page. We don't need to go to it. The 8th of September. And on the last page, there is your signature beneath the statement indicating that you believe the contents of the statement to be true. Is that right?
Correct.
Mr. Raab, you were elected the MP for Esher and Walton in the 2010 general election, I think it's right to say.
That's correct.
And you have, of course, been an MP ever since. You held a series of junior ministerial roles between 2015 and 2018. Is that right?
Correct.
It was in July 2018 that you were appointed as the Secretary of State for exiting the European Union, a post you held until November of that year.
That's correct.
And then in July 2019, you were appointed as both First Secretary of State and also Foreign Secretary, and those two posts you held for a 2-year period until September 2021. Is that right?
That's correct.
And perhaps it goes without saying that that is the period with which we will be most concerned in the questions you have to answer this afternoon. But just for completeness, first of all, we should bear in mind that midway through that period, the Foreign Office was merged with the Department for International Development, so you took on that extra aspect of its responsibilities whilst Foreign Secretary. And then secondly, you were, in September 2021, appointed as Secretary of State for Justice and Lord Chancellor, and also Deputy Prime Minister. And those posts you held for about a year until September 2022, and then again under the current Prime Minister between October 2022 and April this year.
All of that is correct.
Thank you. As I say, of course, the questions we have for you this afternoon will focus on the period of the pandemic. And in very broad summary, would it be right to say that for a period of about a month in April 2020, because as we'll come to hear, because of the Prime Minister Boris Johnson's illness, you had a very particular role. You stepped up and essentially took his place for a period of about 4 weeks at that time. And then both before that, from January to April 2020, and in the period afterwards, you had a rather different role, principally as Foreign Secretary, but also supporting the Prime Minister as First Secretary.
Yes, and I mean, I should say, I still tried to do the Foreign Secretary role at the time I was covering for the PM when he was ill-disposed, shall I put it like that. So the Foreign Secretary role didn't drop away.
No. Well, perhaps the role of Foreign Secretary is one that's reasonably familiar, and of course we'll come to some of the detail in a moment. But I'd like to ask you just a little bit more about the role of First Secretary, which is perhaps less well known. And to do that, can we look, please, at paragraphs 19 and 20 of your witness statement on page 6. You make the point there, Mr. Raab, first of all, and perhaps this is worth bearing in mind, that the role of First Secretary is not one that is always filled. And indeed, as you note, it hadn't been occupied prior to your appointment, as I mentioned, in July 2019. Is that
Correct,
right?
yes.
Just help us. You go on to talk about the role of Deputy Prime Minister a couple of paragraphs further down. I think you would say that both roles are somewhat hazy and depend rather on who's filling them and what the wishes of those who've appointed them to that post are. But are they, in one sense, fairly similar? And another way of asking the same question, would there normally be a First Secretary and a Deputy Prime Minister or not?
I don't think I've ever known of a situation where you would have a First Secretary and a Deputy Prime Minister. The Deputy Prime Minister role is more formalised, but as you said, it all depends on the wishes of the Prime Minister and, frankly, the structure that he and the occupant of the role wishes to put around it. Whether it's and normally the lead will come from the Prime Minister.
Yeah.
The most obvious recent example, other than myself doing it or the subsequent holders of the office, is when we were in coalition and Nick Clegg was Deputy Prime Minister. I mean, I know others have done it before, but there, in the context of a coalition agreement, you can see how a structure would be formalised. But there aren't. There's not a sort of detailed manual.
No. And certainly, I think it's apparent from paragraph 20 of your witness statement that rather formal and well understood role that Nick Clegg held was rather different from your role as First Secretary during this earlier period. As you say here, you understood the role to be, your words, a sort of gap-filling fixer, being asked to do certain roles that perhaps fell outside the portfolios of other cabinet ministers, supporting the Prime Minister when you could, and of course, as we'll come to, stepping in for him when necessary.
Yes, I mean, there's different ways you can do it, and I think that's basically right. The reality is the demands on any modern Prime Minister are several times what he or she could realistically do, and therefore you need to prioritise to the extent that a First Secretary or DPM can lighten the load. I think it's a smart thing to do. And what I would try and find is the serious, earnest, but perhaps not either politically as imperative stuff for the PM to be spending his precious minutes on, and just try and shift a little bit of that off the plate. And I've done that for two Prime Ministers.
Just before we leave this, in imagining your role during this period, 2020, and into 2021, it would be wrong, wouldn't it, for us to imagine that you were fulfilling a role that meant you being by the Prime Minister's side all the time?
Oh, in fact, I would say it was quite important in discharging that role to precisely to allow the Prime Minister to go and do other things. So sitting there, I mean, that's what a Chief of Staff is for, you know, a member of his private office to man-mark the Prime Minister, whoever that would be. That's not the role of the First Secretary.
And just to put some focus on that, this inquiry has heard a lot of evidence about the daily meetings that the Prime Minister undertook, the 9:15 meeting, the quads, the informal meetings with the Chief Medical Officer and so on. We'll see that you attended those meetings occasionally, but certainly it was no part of your role as First Secretary to be a regular attender of those meetings.
Yeah, I mean, my experience of government meetings is you can have over-attendance, if I can put it like that. But you need the right balance between diversity of views in its broader sense and then be able to cut to the chase and make decisions. And you don't need everyone there. Otherwise, it becomes, if you like, a climbing frame with everyone trying to crawl over it without actually being able to chart a way forward. I think that's actually a mistake. So for sure, I wouldn't have expected to be there in the room with the PM all the time holding his hand. He didn't need that. Neither Prime Minister I've worked for have, nor have any of the predecessors.
Yeah. I'd like to ask you just a couple of points about more general governance issues before we turn to the detail of the chronology. And the first relates to the role of the Cabinet in decision-making during this period, 2020-2021. The inquiry has heard evidence from a variety of witnesses, I think initially from Helen McNamara, but then from others, including Mr. Javid today, about, if you like, the marginalisation of Cabinet during this period. The idea being of, whereas Cabinet may have previously have been an area where policy was debated and formed, if you like, a practice developed, no doubt not uniform, but nonetheless it became more frequent for policies to be decided in smaller groups and then presented to Cabinet for decision making, or even perhaps one might describe it as rubber stamping. Is that a description that you're familiar with from this period?
Yes, I probably wouldn't agree with framing it quite in those terms. I think Cabinet can be used for a scalable range of business, from an open discussion to tease out views, to decision-making with some rapidity and all the points along the spectrum in between. That's been the case for every Prime Minister I've served, including David Cameron. So, for example, just in the context of Brexit, of course, Cabinet was incredibly important, but you had then, as you did under COVID, you had the Brexit the excess, as it was called, and XO, and like we had COVID-S and COVID-O, and you also had other COBRA meetings. You would expect to distill decisions down with the right cast, then to put it to Cabinet, but Cabinet doesn't need to duplicate discussions that have been held at length and where the decision has been considered at length. I mean, I think that would be, frankly, poor use of ministers' and government's time. But it depends what the issue is. I think what is important is that Cabinet can, and anyone in Cabinet who hasn't been privy to some of those early discussions, either because in honest terms they're peripheral to them in terms of their brief, or because something may have been missed in good faith. I think it's always the opportunity to raise a hand and question and test. And that happened right the way through the period. But Cabinet was a tier on top of all of these other tiers of government put in place to deal with the emergency.
Well, I'm just picking up on that last point, Mr. Robb. One of the suggestions that's been made is, as a consequence of Cabinet decision-making being drawn back, something of a variety of input, an understanding, a broad understanding of real life may have been lost. Do you agree with that or not?
No, I don't think I do, not in those terms. I mean, whether any cabinet, whatever the composition, is going to be a perfect ecumenical reflection of society, I'm not sure that's what actually it's there for. But certainly the combination of cabinet, wider government and parliament should mean that we are as sensitive as we possibly can be to all of the strains of information, the views, the sensitivities that are going on. Look, I think Tony Blair said you pay your money and you take your choice. You can have endless conversation, in which case you'll never make decisions. Or you can try and strike the right balance between getting a proper diversity of views, I mean in the sense of variety of views, and test and challenge them, but then be very clear when you need to move forward, which of course in an emergency like COVID you do, and make decisions. The conversation and the discussion cannot go on endlessly, as fascinating and as useful as it might be at an academic level. In the same way, and I think I found it informative and learned a lot from the two major scientific officers, so Patrick Vallance and Professor Whitty, about how SAGE operated. I mean, you could debate as scientists, just as I'm sure lawyers, and I say this as a recovering lawyer, could debate the themes, the evidence endlessly. At some point, you've got to decide and take an actionable way forward. And that's where Cabinet comes in. And to be honest with you, wherever along the spectrum you are on that, someone will criticise you either for not canvassing a broad enough opinion or for not being decisive enough. And as I think Tony Blair said, you pay your money, you take your choice. I actually found, I mean, I'll let you ask the questions, but I overall, within the limits of what you could do in an emergency of this nature, as unprecedented as it was, with Cabinet such as it is and the Whitehall infrastructure such as it is, I think we probably struck about the right balance between testing and canvassing views, but making sure we took action.
Thank you. Let me ask you about a different matter, and that is the role, the influence of Dominic Cummings in Downing Street during 2020. Again, the inquiry has heard a lot of evidence about what he did. We've heard from him himself, of course. Various people have described his influence, his decisions. What was your impression of him, and what's your understanding of the role he played in decision-making in the early months of the pandemic?
You may need to unpack this into slightly more closed questions, otherwise I'll end up rambling on. But let me give you my headline view. First of all, I think the big challenge in number 10 is having a chief of staff who does the organisational structural role, which is, if you think how precious every minute of a Prime Minister's time, and we all accept that it is finite, how you organise that time authoritatively. Because everyone, you could, 10 times as many people want to see the Prime Minister or want that part of his or her time than is physically possible. That's a really important role. I think under Boris Johnson, Eddie Lister wasn't in there as a chief of staff, but as a sort of eminence grise, a wise pair of hands. I thought he had the right skill set for that. In terms of Dominic Cummings, that's not why he was there, whatever the title. He was there, it was to drive forward delivery, and also I think, and he was certainly well disposed to this, and I think well suited to this, try and amidst the daily hustle and bustle of events brought up by the media or whatever was the issue of the day, take a half step back and try and look strategically. And I think that was the intention of his role. And I also thought, you'll come on to this, you'll need to ask me, but in terms of diagnosis, I mean, quite a few of the things that he diagnosed that were wrong, I think he was right about. And actually the pandemic was a proving ground for some of those things, like data in Whitehall, for example, like accountability in relation to the brilliant civil servants that we have. I won't delve in too much that until you lead me there, but equally, I was 6 years civil servant as a Foreign Office lawyer, and I have very fond memories not only of my time as a civil servant, but also the professionalism there. So you're not talking to someone who's down on the civil service by design. And what you're looking for, in my view, and I think SPADs, including the most senior ones like Dominic Cummings, We're looking to try and form this synergy between the role the civil servants play, candour advice, sense checking, and fundamentally executing policy, and ministerial accountability to the public for those decisions. I don't think any government gets this perfectly, but what you're looking for is that synthesis. Spads and Dom Cummings, in particular, are there for that, and I think that is critical.
Mr. Rabb, that's an answer about what they might have been there for in principle. Can you help us with your experience of Mr. Cummings in practice? Let me read you one sentence of Mr. Javid's witness statement. He said this: "I felt that the elected Prime Minister was not in charge of what was happening in his name and was largely content with Mr. Cummings running the government." Do you agree with that?
No, I don't. But let me just say at the outset, and I don't say this as any disparagement on this committee or this inquiry, but there's a whole circus that can be built up in the media and elsewhere around the internal battles between individuals. And some of that is natural and healthy. You know, you have tensions between civil servants and SPADs, between all of those and ministers, and of course between ministers. I, by the way, worked very closely with Sajid Javid. In fact, I worked for him when I was housing minister. I like him, I respect him. I think he's a great operator and decision maker in the way we were just describing. So I got no beef with Mr. Javid. But equally, I don't think that's quite right. I think Dominic Cummings, certainly on diagnosis, but also in trying to galvanise direction of travel, was much needed, some grit in the oyster. I think if you look at some of the things he said, we may come on to this, but the obvious one I think of is the osmosis between professions from outside of government in government. Funnily enough, Chris Whitty and Patrick Vallance are great examples of this. I mean, when we came on to the vaccine trials and all the rest of it, having someone who has not only been a scientist, who knows how government works, but also been in a major multinational, taking a drug from trials to commercialisation, I mean, it's just gold dust. I think Chris Whitty was superb as well. And one of the things I think Dom Cummings had noted and observed is sometimes Whitehall can feel a bit like a closed shop. So I want to give you a sense of which I think he correctly identified some of the structural challenges without getting into the he said, she said, frankly, soap opera of Westminster bubble politics. The broader question you raised about whether Boris Johnson was a puppet, I'm afraid I don't find that a serious allegation. I think Boris Johnson certainly relied on his key advisors. By the way, I think you have to, if you're going to get through the work, particularly in a pandemic. I don't think, looking back at Prime Ministers past or present, if I look at Theresa May, or if I look at Tony Blair and the role of his Chief of Staff, his Director of Communications, it is natural. And if you present me something in a specific scenario, I'm happy to comment on it. But and Boris, just like anyone else who occupies that incredible role, and I feel some empathy with anyone who's done the job of Prime Minister, because I covered it for a month, and I think that made me a better Secretary of State because I could see quite what the pressures were the Prime Minister has to deal with. But you've constantly got this challenge of wanting to control the levers that affect government policy, but also knowing that to run an effective government, you need to delegate. And of course, you should delegate fundamentally through your Secretaries of State and your ministers, but you also delegate with advice and reliance on your special advisors, just as you do through senior members of the civil service. That is natural and proper, and I just don't accept the characterisation that there was some sort of puppet regime.
Mr. Rabb, let's move on and look at the early months of the pandemic.
Before we do, can I just issue another assurance, as I did yesterday, Mr. Rabb? When we're looking at whether or not there was a toxic outbreak, it's not from some prurient interest that we want to hear rude words or anything. It is to see whether or not there was anything wrong in the decision-making process. And that's why we're asking the questions. I understand why you're asking the questions, Chair. I totally respect it. I'm not suggesting, but we also know that there's if you like, a parallel soap opera in the media that will play out these things and magnify and I just, I want to give you honest answers, candid examples. I want to give the best evidence I can for the bereaved, and fundamentally, if this is a lessons learned exercise, I want us to understand where we've just got political noise and where we've got substantive issues, and let me try and
assist the inquiry as best I can.
Thank you.
Let's turn to the chronology then, Mr. Raab. Your witness statement sets out in some detail what you were being told, what you were doing in the first few weeks of 2020. I'm really talking about January and very early February here. We may come back to some of this detail, but is it fair to say that at least two of the things you were principally concerned with in that time regarding the pandemic were, first of all, amendments to the UK travel advice for China, considering whether or not to make amendments and over time making those amendments, and also dealing with various issues regarding the repatriation of British nationals?
Yes, to the extent that my job and role covered the pandemic, there is a whole string of other things. Every crisis, you can imagine what it was like then compared to now.
And I think I was clear in my question that I was just asking you about those matters.
Yes, and I think the other thing, if I may just say, on travel advice, trying to explain throughout government, which may be helpful just to echo here, the difference between travel advice and changes that are made to it compared to, for example, border restrictions, and that these are different decisions for different purposes, and actually we're legally constrained, I'm sure we'll flesh this out, in the way that that takes place. But yes, of course, looking at that very carefully and ultimately taking advice from the CMO and others on that.
Yes. You also detail, Mr. Raab, that of the two COBRA meetings that took place during January that we have heard some detail about, you didn't attend the first meeting. You sent one of your ministers to attend that meeting, but you did attend the second meeting on the 29th of January. Now, I want to move just a week or so forward in the chronology, because the inquiry has heard evidence about a meeting that took place on the 4th of February between the Prime Minister and Chris Whitty, the Chief Medical Officer. This wasn't a meeting, as far as we know, that you were at. You may not have heard anything about it. That's one of the questions I'm going to ask you. But what we've heard is that, first of all, this was the first time that Chris Whitty briefed the Prime Minister relating to COVID, and that, in summary, what Chris Whitty told the Prime Minister was that there was a reasonable chance that there would be a pandemic in this country involving between 100,000 and 300,000 deaths if the COVID-19, which was then in China, spread internationally and became a pandemic. And we've heard from Chris Whitty that range, the 100,000 to 300,000, was not intended, nor was it presented to the Prime Minister as a sort of formal, reasonable worst-case scenario. They were intended as an indication of the seriousness of the situation if a pandemic of this new infection were to emerge. Now, I'm sure you'll agree with me, first of all, that that was a very grave piece of advice that Chris Whitty was giving to the Prime Minister.
Of course it is, yes.
May I ask whether you were aware of that meeting or what it was that Chris Whitty had conveyed to the Prime Minister at it?
I can't recollect, but it's not remotely unusual that I wouldn't have been at that meting.
No, I'm not suggesting it was. I simply want to understand whether you were or whether you'd understood it at the time. Let's go, if we may, to paragraph 58 of your witness statement on page 18. You describe there that, in fact, on the day of that meeting, you went on a pre-arranged trip, undertaking your official duties as Foreign Secretary to Australia, Japan, Singapore and Malaysia, and you were gone for about a week, as we can see there. And I think it's also right to say that later in February, after your return from that trip, you went on a family holiday or a personal trip skiing. Is that right?
Yeah, I mean, that is correct. I mean, in fairness, if you're taking the whole chronology, I mean, and this is the life of any modern Foreign Secretary. I was in Brussels first week of January, in the US and Canada the second, third week or around the same time I'm in Paris.
Yeah, I'm just going to interrupt you, Mr. Raab, because we have got limited time. We have your
but I think
witness
it's
statement.
important, because I think I know where you're going with this. If I may, just to very briefly say, I went to Australia, Japan, Singapore and Malaysia, vital countries for the UK's foreign policy, and as it turned out, the relationships that we needed to service during COVID. And again, first week of March, I was back on the road to Oman, Istanbul and Saudi. That is the job of any modern foreign secretary.
Don't worry, I don't think Mr O'Connor's going to suggest you're on jollies, Mr Rob.
Glad to hear it.
Just wait for the question and then he'll make it clear.
The question I want to ask you, Mr. Rob, focuses on this time in February, where, as we've seen, first of all, you did this official tour to Australia and to those other countries. And secondly, after you got back, as I think you've agreed, went on a family holiday. What we can read into that, alongside the fact that at the beginning of that month, the Prime Minister had been told of this grave news about the COVID pandemic, which one might have thought, and certainly with hindsight now we can perhaps see, demanded a considerable upgrading of the government's response. Were you aware at that time of anyone suggesting to you either that it might not have been a good idea for you to leave the country, that you were needed, perhaps in your role as First Secretary, to be involved in work towards preparing for the pandemic, or that it wouldn't be advisable for you to take a holiday during that period?
So, 3 points. First of all, of course, the advice that you cite from Professor Whitty to the Prime Minister was hedged with all sorts of caveats and uncertainty. And as a common theme of the pandemic, we had potential scenarios with evidence which was hedged. And I think at a range of moments, and you have to ask the Prime Minister, former Prime Minister, I'm sure you will, where you've got formative evidence coming through, which is still being tested, and at what point you make a go, no-go decision on whatever decision that may be. So, I think when I've looked at the minutes from the meeting that you referred to with the Prime Minister, I think it's hedged with, again, all those caveats and uncertainties. So I think, first of all, we need to understand that you take the decision when you've got sufficient evidence, and indeed when the CMO advises sufficient evidence to take actionable decisions. In terms of my travel, just to be really clear, of course, right the way through the pandemic, if it was either unwise, unsafe, for COVID reasons to leave, I would have been umbilically linked to the CMO in terms of chains of communication, and we would have been advised. I was not advised not to go. Indeed, it, I think, was very important, both for relations with all of these countries and the relations that we would have to tap, whether it was for PPE, whether it was on vaccine discussions or whatever it may be, that we did have those relations, particularly, as I say, with the likes of Australia, Japan, Singapore, Malaysia, but also, frankly, all of them. In relation to the week away, as you can, I think, see from the chronology, being Foreign Secretary is a pretty gruelling agenda, and that comes with the territory. But equally, you will have noticed, and I'm sure you've got and seen and digested, the FCDO corporate chronology that was sent on the 23rd of December 2022, which details, and I'm very happy to go through it in laborious detail if it's helpful, but tell me if it isn't, all of the decisions, the communications and the meetings that I conducted during the February half-term, which you referred to, when I was away. Again, whether you're away on very rare leave that you get as Foreign Secretary, or whether it's because you're travelling on business and you need to stay in touch with what's going on in Westminster, I mean, that's just bread and butter. But at all moments, when I was needed, I was there, and certainly directing what my department needed to do if it wasn't easily delegated, which again, you need to do during a pandemic and actually in terms of business as usual.
Mr. Robb, one of the questions that this inquiry will have to consider is whether that month of February was spent properly by the government, not on business as usual, but on understanding and preparing its response to the COVID pandemic. Now, with the benefit of hindsight, do you think that enough was done during February, both by you and others, or not?
Yes, but look, as you say, it's with the benefit of hindsight. The reality is, at all moments, we're looking for enough evidence and credible, decisive, persuasive, overwhelming evidence, not just strands of evidence here or there, not just theses which haven't probably been tested, but conclusive evidence on which you can act. It's actionable evidence. And ultimately, we had to rely on the advisors for that. Now, a whole range of contingency planning was underway. But one of the things that was important is that the government didn't seize up, paralysed, because we could see evolving a pandemic or an emergency, whether it was limited to China, engulfing the world to the extent that it affected the UK. We needed to try and function as best we could whilst preparing for that. But again, you come back to the same point. Contingency planning without knowing with sufficient evidence what the threat was, you just end up rewriting it. And I think one of the things that I learnt during this process is that when it comes to plans during a crisis, it's probably true in wartime, but that's not my experience in terms of direct wartime for the UK, and certainly in an emergency like a pandemic, is you need to try and stay in what I call perpetual beta. I don't know whether you're familiar with the phrase, but if you're testing a drug or technology, the last test you do before you put it to market is with real-time users. So you have your plan, but you're constantly testing and reiterating and refining the prototype. I think we and Whitehall needs to get much, much better at that. And curiously, one of the people that warned most about that, and I don't need to be the apologist for Dominic Cummings, was Mr. Cummings. I think your broader point, though, was, in retrospect, was February a decisive month? I think it was. But you can see that in hindsight. And it was the tipping point where we really learnt more sufficiently about the pandemic to tip the balance into, OK, well, now we've at least got enough evidence to take some actionable decisions. And I think that's the conclusion I came to.
Well, Mr. Robb, we can all think of our own management speak to describe these indications, but are you really saying...
So with the greatest respect, it's not management speak, it's science. And the people that have looked at, for example, forecasting, people have looked at why decisions get made that are wrong, both in government and outside. People like Daniel Kahneman, who won the Nobel Prize. So not just management speak in the pejorative terms. People like Philip Tetlock, who have looked at how you improve, would say you need to strike this balance between moving forward and making decisions and, if you like, digesting the evidence. So I think it's... by the way, if it comes to a piece of learning for this inquiry about how government works, I think it is probably the single most important thing. And I don't think you should be quite so dismissive, if I may say so with respect, as management speak. I'm trying to give you a thoughtful, considered answer about how government works.
Can I ask you a direct question, Mr. Robb? Are you telling the inquiry that at the beginning of February, the government had inadequate evidence with which to take further steps that it could and should have taken?
So when we constantly peppered Chris Whitty and Patrick Vallance with these kind of questions, and then there was frustration with the science itself, not just the evidence we were getting or the propositions we were getting, but and I think I had a long conversation with both Chris and Patrick, who I think very usefully said, well, you can't think of the science as something which is decisive and then set in stone, which is why I come on to the perpetual beta point. It is something constantly being tested. And the point I'm making is I don't think we had a definitive enough answer about what the pandemic was doing, the rate at which it was spreading, what it would mean for the UK, let alone the other knock-on questions that inevitably need to be asked, which is what does that mean for the NHS, in particular ventilator beds and ICU? And also another big question, how long can you credibly stay in lockdown in a liberal democracy like the UK? So I think what I'm trying to help you with is that I'm sure with the benefit of hindsight, if we took a decision on, whatever date it was, you can always ask, weren't you versed enough a day before to take that decision? That's the luxury of hindsight. I think we genuinely tried to move decisively at the point at which the evidence was compelling and we wouldn't then just be buffeted between competing evidence that would show up the next day or the next week. And that's the balance.
Mr. O'Connor, we're going to pause there.
Thank you, Molly.
Thank you. 25 to 6. We'll 25 to 4. Is that right? Mr. Robb, we will complete your evidence today, I guarantee, but we do take a break.
No problem.
Mr. O'Connor.
Mr. Robb, I'd like to ask you a few questions about the first lockdown decision that was taken towards the end of March 2020. May we go to paragraph 106 of your statement, please, on page 32? The second sentence of that paragraph, Mr. Robb, you state that you cannot remember exactly when you found out that the lockdown was going to be imposed, but that it didn't come as a surprise. May we take it, therefore, that you weren't sort of minutely involved in all of the discussions and meetings and so on that led up to it?
Well, it depends what you mean by minutely. I think the point I was trying to convey is that there are a series of incremental steps by which it became predictable, or at least foreseeable, that we would have to lock down as a necessity, and therefore it didn't take me by surprise. Equally, I'm not quite sure what the decisive moment where someone said to me, by the way, you know this is going to mean a full-blown lockdown. But it was I think it was more an incremental moving towards, rather than, although I'm sure to the public it appeared like a cliff-edge decision, it felt from the inside like an incremental series of steps that we inevitably ended up taking.
I wanted to ask that because if we look at the sentence before it and the sentence after it, you say that by the 23rd of March, which was, of course, the date the lockdown was announced, the Prime Minister had already tested out the various components of a lockdown with Cabinet and with Cabinet subcommittees. And then in the sentence two further on, you say the various elements had been the subject of technical discussions in COBRA or subcommittee meetings already. The evidence the inquiry has heard is that the period of, let's say, 10 days leading up to the lockdown decision was a little bit less mechanical than that. There were crisis meetings, disagreements, meetings with the Prime Minister where he gave different people different understandings of what he was going to do, saying that he wanted to be the mayor from Jaws, discussions with Sadiq Khan over the weekend just before, saying he couldn't decide whether to have a lockdown or not, worrying about the economic aspects. No doubt a very serious decision, very serious trade-offs, but not quite the sort of cool, calm, everything had been carefully thought through, all the aspects had been looked at in different subcommittees running up to that decision. Can you tell us that something different happened, or were you not as close to the decision-making as others?
I'm not sure that, well, I was close to the bits that I was personally involved in. For example, the global travel advisory was in place on the 17th of March, just by way of example. I'm not sure taking an incremental approach is inconsistent with a Prime Minister who, if that was your reflection, took a rather Hegelian approach to making decisions, thesis, antithesis, synthesis. And that was actually very commonly what he did, both in meetings and, I suppose, in his thought processes. And I don't think, I mean, people have different ways of doing that. They can be inductive, deductive. But I think testing viewpoints and possible outcomes actually is quite a healthy thing to do. And I think one of the things misunderstood about Boris Johnson, and we all have failings for sure, is he was much more open to hearing contrary views than some other Prime Ministers that either I've worked for or you can think back over time.
Yes, thank
and
you.
And therefore,
Mr.
if he wanted to test something, he would often want to hear a counterpoint. And that doesn't mean he was wavering or vacillating. I mean, it might have done, but doesn't necessarily mean it. It means he wanted to stress test, kick the tyres.
Mr. Robb, several of the witnesses who were involved in this decision-making have expressed the view to the inquiry, with hindsight, that first lockdown decision should have been made earlier than it was. perhaps by a period of a week or a little more. What's your view about that?
So I've heard it and I've listened to it, and we thought about this at the time. One of the big challenges was working out how long you could realistically, credibly lock down for, because you need to do so with the overarching goodwill of the country and the stamina of the country for a full-blown lockdown. I mean, we asked Chris Whitty and Patrick Vallance about this. That's a huge variable. And the challenge, as I think you'll have heard and everyone will be familiar with, that the issue with lockdown was to try and protect the NHS, particularly the ICU, flatten the peak of the virus and protect the NHS from being overwhelmed. There are all sorts of other considerations, but that was a critical one. If you go too early with your lockdown, the risk is you end up having to come out too early, or it frays. And I've heard people say we should have gone down early, and it's an easy thing to say with retrospect. But do they also answer the question, does that mean we would come out of lockdown early? And if not, can they answer the question, it's a rhetorical question really, about all the other consequential questions about compliance and what that would have meant? Actually, during the lockdown, compliance to the British people, I think because they understood why, the compliance was extremely high, particularly for a liberal democracy which is used to exerting its freedoms. And I think that was partly because the case was clear, and that's partly because we could present the cases clear. So I'm not being dismissive of other viewpoints about this. I just think you have got to answer that other question about stamina of the British people for a lockdown of that nature.
Yes, and all the factors you've just listed, which were in play at the time, have all been considered by the witnesses who the inquiry have heard from, scientists, decision makers. Several of them, Patrick Vallance, Chris Whitty, have expressed the view, carefully reasoned, that knowing what they know now, the lockdown should have been earlier. I'm interested to know your view on that.
Well, knowing what we know now, look, possibly I'd need to look at all the data and the evidence. What Chris and Patrick did, which I think was very useful, is they often had, if you like, a matrix of what we've got to think about is four things above all. There's always other, but forefront: COVID impact, non-COVID health impact, economic impact and social impact. And we would often test, and I certainly would try and test with them, those four things. And the risk, of course, in an emergency is all of your mind is on the COVID impact, and that's understandable given it was given the huge loss of life. But you've also got to think about the opportunity cost or the opportunity losses, including human loss of life, of those other three areas of the matrix. So, with retrospect, look, that's for the committee to decide and the inquiry to decide. For my, I think the most important thing I can say is, at the time, there was just so much that was fluid in terms of the evidence and too many questions, and you can't wait for perfect knowledge. So, and I'm all for making a decision, which is why that point about perpetual beta. Sometimes you'll need to go with your let's say 90% formed view, but just recognise that you're going to have to iterate around it. But I actually think if you look at the consequences of the time, and you could probably, and I know economists would make the argument and others would make the argument, that actually, we locked down too much. I'm not saying this is my view, but because of the cost of the economy, because of the languishing effects of the non-COVID NHS backlogs, because of the impacts on our children of shutting schools, which I was very mindful of. So I'm just saying, when I look back, I'm very conscious that we made the best decisions with the science, as fluid as it was at that point in time. And I think that's the best you can, in good faith, do.
Let's move, Mr. Raab, to the slightly later period when, as we've said, Boris Johnson became ill and you stood in for him. In summary, the chronology was that Mr. Johnson announced that he tested positive on the 27th of March. He went into hospital a week or so later on the 5th of April and went into intensive care on the 6th. That was a Monday. And is it right that it was that Monday that you commenced deputising for him, and that went on until he was discharged on the 12th of April, and then for a couple of weeks after while he recuperated until the 25th of April?
Yeah.
Are those the dates?
Correct.
Now, If we look at paragraph 125 of your statement, Mr. Raab, on page 38, you describe the circumstances in which, as it were, it was you who deputised him for him and not someone else. You say, I'm looking towards the bottom of that paragraph, I'd had a conversation with the Prime Minister in which it was made clear that if he was to be indisposed, I, that is you, would step in and deputise for him. I'm going to ask you some sort of questions about the constitutional situation and how developed the planning was. Are you able to help us with whether it was routine for Prime Ministers to have someone identified who would deputise for them if they were indisposed, or as far as you're aware, was that unusual?
No, I think it's unusual, but for completeness, there are all sorts of security and national security scenarios, which, forgive me, because of the propriety and sensitivity, I won't go into detail, but just to give you a flavour, where whether it's because of indisposition or lack of availability, you make sure you've got cover.
Yes. But you, in any event, had that conversation. Was that, I won't press you on the detail for obvious reasons, but was that discussion limited to that sort of national security situation, or was it a broader conversation?
So I can't remember all the details of it, but the truth is, when I was appointed Foreign Secretary and First Secretary, the PM was very clear: I'm appointing you First Secretary so that you've got my back, and that if ever it's required, you can cover for me. Yeah. There's some regular routine things like PMQs that just, but I mean, that's not at the, I would say, the most acute end of the seriousness that we're talking about now, but it just logically follows from that. In terms of contingency planning around that eventuality, no, I think it was pretty sparse. Yeah. I mean, I was effectively really told on 5 minutes' notice.
Well, let's move, Mr. Rob, because that was going to be my next question. If we look onto the next page, paragraphs 126 and 127, there you discuss meetings that you had with Helen McNamara, the Deputy Cabinet Secretary, and Mark Sedwill, about how this was to work. And we've heard from Helen McNamara that, to use your words, the planning was sparse. I mean, to use others of her words, they were making it up as they went along. You raise questions as to, well, is it appropriate for you to chair Cabinet? Give us an idea of, from your perspective, of how clear or unclear it was as to how you were to do this job.
Well, the first thing, not clear at all. There's no manual, there's no guidance. I was told on 5 minutes' notice. In fact, I'd given, I think, the press conference. We had those daily press conferences where the scientists would speak, a senior minister would speak, you'd take questions and tweets from the public. And then I think I was informed literally as I came out of that. I think there's a number of things that were on my mind. One, just steady the ship. It's a big deal. I also noticed at a human level, just as we all had experiences of this awful pandemic, I knew a lot of people would be in the Cabinet would be personally very worried about what this meant for the personal condition of the Prime Minister. I know it's easy to discount that if you're in the public at large or with the media and what have you. But I think there's a lot of that. You want the government to respond in the right way, and the Cabinet to respond in the right way. I think there's an element of reassurance to give the public. And so there's that. So I think I did a clip to camera and we basically emphasised that message. I thought, and then there's all the work that's going on from the strategic preparation for I think it was the 5 tests for how we would come out of lockdown. I knew that the PM wanted all of that work being done for when we would be able to do that. So there was that strategic work. There was all the operational minutiae of stuff going on in every department. We had a good cabinet, we had good secretaries of state. I wanted to trust them to do that job. They would certainly not have welcomed an overly micromanaging step-in first secretary. I was very conscious of that. But I did think it was important, for example, to get them together, to get the team together and just say, come on, we've got this. PM's going to be fine, fingers crossed, which is all we knew at that time. Let's make sure when he comes back conscious, we've all done a good job, both individually as a team. I think there was some nervousness. I was told no one who wasn't a Prime Minister had chaired a Cabinet before. I got to say, I thought, that's not really the thing that matters right now, although I understood and respect. By the way, Helen and Mark Sebel and Helen McNamara, good colleagues. I've respected them. But I thought the right thing to do for morale, both of the Cabinet and the government, was say just to get everyone together and have a bit of a team talk. And also just to check who was worried about whatever. And there may be other things we hadn't thought about because there hadn't been a huge amount of contingency planning. We ended up having a cabinet discussion rather than a cabinet meeting. Fine. I think we had a couple of those in relatively short order. And I think it was just at that human level important. But the most important thing was to make sure that you could show government was working, that there was a government functioning, that there was a First Secretary that was in charge. And I suppose that, again, at another human level, I didn't want anyone saying, well, Dom Raab's enjoying this just a bit too much, because A, I wasn't, and B, I was there to do a job. And I felt very loyal, as I have done to every Prime Minister I'd served, to make sure it was done as professionally as possible.
In terms of learning lessons, Mr. Raab, and particularly in the context of pandemic preparedness, what happened in 2020 is perhaps it wasn't unforeseeable if a pandemic sweeps the country that one of those affected may be the Prime Minister. Do you think there ought to be clearer guidance in place in time for the next pandemic in case the same thing happens again?
I think it probably would be worth doing. Although, so I'd say two things. One, surely you should have some discussion and some principles, and you should avail the current Prime Minister and whoever their nominated deputy is, whether it's his First Secretary or Deputy Prime Minister, they ought to have some kind of conversation about what's expected if the Prime Minister becomes indisposed other than for travel. Having said that, again, it's not for me to say it, but I listened to some of the evidence of whether it's political evidence from SPADs like Mr Cummings or Fiona. We actually did a reasonable job during that 4 or 5 weeks. I think all the things that needed to happen did happen. We were well advanced on the readiness with the 5 tests for how eventually we'd come out of lockdown. And I'm not, again, I don't want to overstate this. I think with a pandemic and a crisis, it's useful to have some handrails. So yes, a bit more lessons learned and a bit more contingency plan would be useful. But actually our system worked, and as is often the case, with sort of British pragmatism and the if you like, informal conventions that inform how we make decisions actually did see us through. So yes, a bit more codification probably, but actually I don't think we did too bad a job given the circumstances.
Thank you. Just briefly, if we look at the bottom of this page, you will see just at the bottom of paragraph 129, you refer there to the Easter review. I think you mentioned it just in passing a few minutes ago. This was one of the features, wasn't it, of the 4 or 5 weeks that you were at the helm. Just briefly expand on what that was all about and
we had 5 tests for so the Easter review was, having gone into lockdown, you want to make sure people feel like there's some sort of light at the end of the tunnel, and therefore the Easter review would be that moment, and it would be judged against 5 criteria, which included everything from the state of the NHS, in particular ICU, the R level, so the transmission rate, through to the impact on the economy. So I think trying to make sure you've got some good, clear benchmarks, and frankly, and this is a common theme, I don't know whether we'll get a chance to come onto it, but the data to inform those benchmarks so that Easter review could be meaningful.
Let's look at another document, if we may, please, Mr. Raab. It's 136763. This was a review of the culture in number 10 and the Cabinet Office that was undertaken. If we can look at the whole page, we can see the date there, May 2020. It was undertaken by Helen McNamara and Martin Reynolds. We've heard evidence about both this review and the issues that prompted it, Mr. Raab. In summary, problems with working both in number 10 and the Cabinet Office, division between the two, unhappiness amongst at least some of those working there. If we look at page 3 of the document, paragraph 2 of the review, a paragraph we've looked at before. Problems listed there, not enough grip in the Cabinet Office, plans not being drawn together, not enough scrutiny. Number 10 is strong but not pulling in the same direction. Sometimes the system's got flooded with unprioritised demands. Culture isn't getting the best from people. A couple of lines down, there's a particular issue with junior women being talked over or ignored. As we saw, one of the phrases that was used in the preparation of this document, although it didn't find its way into the final draft, was describing what was going on as a so-called superhero bun fight. This review was done in early May, so a week or two after you had or Mr. Johnson had come back. But one infers that these problems must have been evidencing themselves during the time that you were deputising for Mr. Johnson. Were you aware of them at the time?
Oh, I mean, look, I don't necessarily agree with all of it, and I don't propose going through it line by line, but I think they've lifted out quite a few really salient themes around roles and responsibility, particularly in accountability. The feeling often, whether it's in normal times or in a crisis, is you yank a lever, whether it's from number 10 or the Cabinet Office, and you're sort of waiting with it for something actually to happen. That nexus between authority and accountability, I think, is a very good example. I'm not sure I agree with all of it in the sense that, and by the way, I don't think any those who conducted this review came to talk to me, which is, I think, itself quite telling. Not that I would have disagreed with some of these issues, but I think the one thing I would say is, in any crisis, it's not going to be a manicured operation. I mean, with the Foreign Office, we had the Thomas Cook insolvency, we had the repatriation efforts, and we've also, Foreign Office deals with crisis management. It is never perfectly manicured, and there will be certainly people who feel bruised by the pressure of it, and sometimes that will be because someone has behaved inappropriately. I get that, but there is also emergency conditions which create a tension and a combustibility, which I think we just need to acknowledge as a given, however perfect the structure is. So, but I think the bit that I would alight on is endless meetings without a clear enough agenda, with papers focused on the agenda, with an exam question which leads to delivery, with a clear enough SRO, a senior reporting officer, who is actually going to say, if it doesn't happen, why not? And preferably to give you an early heads up. I think there's a delivery function challenge in Whitehall more generally, but I think it shows up during a crisis. One of the things I've always noticed is how often the CFO role and the COO role, so the Chief Financial Officer, the Chief Operating Officer, are often merged. Whereas to me, as a Secretary of State in a big department, I think having a freestanding Chief Operating Officer to deal with both long-term strategic plans, but also the firefighting, why is something going wrong, can we fix it? Again, and that's even before you get into what you do in crisis mode.
Just a very practical question relating to this. Those 4 or 5 weeks that you were deputising, were you actually based in the Cabinet Office or number 10, or were you still working from the Foreign Office?
I would come into number 10 first thing and do the equivalent of the early morning meetings, stay on for any imperative business, but then I went back to the Foreign Office, partly because it was just as easy to work from there. It's literally a stone's throw, because there's a back entrance from the Foreign Office to number 10, but also because I was very mindful of this. If it didn't make any difference to the effectiveness of what I did, I was very mindful of not looking like I was camping out in number 10 while my Prime Minister was ill-disposed.
Yeah. Let me move on, Mr. Robb, and ask you about a slightly different matter. For these purposes, could we go to page 63 of your witness statement, please, paragraph 215. Do you have it?
215.
Yes.
Yes. Go.
Now, this is a paragraph where you're discussing the scientific evidence. You've already mentioned your discussions with Chris Whitty and Sir Patrick Vallance. I want to ask you about a sentence about 6 or 7 lines down. You said, "I never felt that anything was missing, and I'm confident that we received a range of perspectives throughout." One of the issues the inquiry has been addressing is whether sufficient economic advice, economic modelling, for example, was provided to decision makers, and it may or may not be that that was one of the things that you had in mind when you wrote that sentence. Let me give you an example of the evidence the inquiry has heard. Ben Warner, who, in fact, you mentioned in that paragraph, you were obviously, he was obviously known to you. He said in his witness statement, the biggest absence throughout the pandemic was the lack of economic modelling in decision making. So, can we ask you for your view, please? We, as it were, let's park the advice that came through Chris Whitty and Patrick Balance and Sage and so on.
Yeah.
The question is whether that was a sufficiently balanced or added to by economic advice. Mr. Warner expresses a strong view that it wasn't. What was your experience?
Yeah, look, I think it's a very good point. I mean, just on the narrow point you're making that I said I never felt anything was missing, and I'm confident we received a range of perspectives throughout. I'm talking about the distillation of Sage's view
I understand
on the pandemic, just to be clear.
Which is why
I get it. I wasn't talking about the whole piece. Look, I think the way we've got this 4-point matrix, impact of COVID, non-COVID health impacts, economic and social. It is certainly true to say that in the lion's share of meetings which are either COVID, ORS or Cabinet, that there's disproportionate emphasis on the COVID health implications. And that's natural in a crisis. And that's the purpose of what Chris and Patrick were doing in Sage. I think it is also, by the way, I've read Ben's evidence, his written evidence. I agree with, I think I'd struggle to disagree with anything he said, certainly at the point of principle, about not having enough groupthink, not having enough challenges to groupthink. And particularly if all of the COVID perspective is crowding out some of those other things. And you've had a sense of my concern around, I was very concerned about closing schools. I was very concerned that if we locked down too early, we wouldn't have the stamina to see it through and flatten the curve and protect the NHS. Did we always get those perspectives? I think one of the challenges, ever since, well, it's probably been true for all prime ministers since World War II, but you've always got this challenge or this tension between the Prime Minister and the Chancellor. Under Blair, it was called the TBGBs, but you know, we all know what, and it's true, the tension is there because the Treasury is such an authoritative place. I suspect quite a lot of the analysis of the economic impact, so in that matrix, the economic implications, was discussed bilaterally, probably at length, with lots of advisors from Number 10 of the Treasury there and the Chancellor and the Prime Minister. Was it filtered through properly enough to Cabinet, to me, I'm not sure. Certainly, one of the things, the way government operates and Whitehall operates, part of it, of course, is the how convincing the evidence and the analysis is, but also it's frankly the, if you like, the fact that you regurgitate over, like cud, certain consistent themes, and that becomes the benchmark or the bench point that you work to. I think that the concern with all of the direct COVID impacts, as serious as they were, was like that a little bit, in the sense that we just eclipsed the group discussion of some of the wider economic implications. I also can see the challenge. We wouldn't have been able to do both to the same degree. So you choose how you prioritise the time. I also see that the PM and the Chancellor, and I think this is true successively, learning the lessons from the TBGBs, were trying to make sure they would go into that room with a common view. It is awful if you have a Prime Minister and a Chancellor that disagree. And I think the other thing you wanted to try and avoid is it just being the Chancellor and the Health Secretary constantly at odds. So I think the comments are well made. I think we probably would have wanted some more buttressing economic data, sifted and filtered through in a meaningful way, in which, on 2 sides of A4, 3 sides of A4, not just further volumes. But I also understand that trying to get the right balance between discussion that's helpful and that doesn't just create, if you like, systematic tensions which stop you making decisions. So I've tried to give you a full answer. I'm not disagreeing with what you say and what Ben is saying on this.
I mean, on a practical level, and this is something that Ms Warner and others have said, there was a disparity between the SAGE advice, epidemiological advice, going through a particular process and generating SAGE consensus statements, which were available to you and your colleagues. I'm not talking for the moment about them being published more generally. And an absence of similar economic analysis, as you say, being made available on a 2 or 3 page statement to allow those trade-offs to be understood when it came to MPI decision making. And that is perhaps why some have suggested in a future pandemic some idea of an economic SAGE to do a similar job in a different field. Is that
yes.
in a few sentences?
SAGE did elicit quite a lot of controversy, the inquiry will have noted, and therefore having an economic version might just risk amplifying to new levels of consternation. But the truth is, I think you probably would want something as a counterbalance, if you like, the ballast to the SAGE advice. Whether it needs to be a whole new structure, I don't know.
Yeah. Let's move, Mr. Rabb, to the second lockdown, if we may. And for these purposes, let's look at page 49 of your witness statement.
Yeah.
And in the top 2 paragraphs, you'll see there 156 and 157. You describe the Cabinet meeting on Saturday, the 31st of October. We've heard a lot of evidence, again, about the days running up to that meeting and the advice that the Prime Minister had received. You describe then the meeting we see at 157. You say the Prime Minister proposed second national lockdown and regret about the tiers not having had time to prove whether they're effective, and, as you say, the fact that the Prime Minister announced the second lockdown later that day. If we can go on to paragraph 158, you say, in respect of the decision to implement the second national lockdown, the CMO's advice was not binary, but reflected a full spectrum of SAGE opinion for this decision, as for other decisions throughout the pandemic. The evidence the inquiry has heard, Mr. Rabb, is that for some time before this period, so at least for the whole of October, in fact going back to early September, the SAGE consensus advice had in fact been that there needed to be some sort of lockdown. So what do you mean by saying the CMO's advice was not binary?
So I don't remember ever Chris Whitty giving binary advice to the extent that there's only really one option and they don't admit of points along a spectrum. I don't have the advice with me, and I can't recall the precise contours of SAGE on the second national lockdown. But there was, I mean, we lived in an operational world where there was always competing arguments, and even if there weren't competing arguments on the science, the policy options of what you might do which would be effective as a result of the science would and normally you had both. And you probably also had one or other scientist finding their views finding their way into the media. So it certainly always felt like there were options. And in fairness, I think the point I'm trying to make about Chris Whitty is even when he made a strong recommendation, I think he was intellectually and professionally honest enough to say, I'm not saying there's one set view, I'm saying that whether it's the consensus view, and there's a difference between consensus and unanimity, my recommended view is this. He might say it more or less strongly. These are the implications, but I'm also conscious that there will be costs as well. So, I thought we had good rounded conversations. And Chris got the, I think, balance right between giving clear advice, but not foreclosing the idea that there weren't alternatives that could be meaningfully considered.
Can I ask you about a sentence 1 or 2 lines further down?
Sure.
You say there had been positive developments in relation to the vaccine, and there seemed to be grounds to hope it was coming soon. Just remembering we're at the 31st of October here. You're not suggesting, are you, that the vaccine could somehow have made a difference as to whether a lockdown was needed in October, November 2020?
I don't think I'm suggesting. I don't think I was suggesting that. But again, I'd need to look again at what we were being told. I mean, the minute that the truth is, the only way through the pandemic, as it became clear as it evolved, was going to be either a test and trace system of a markedly different quality and efficacy of the one we had, or a vaccine. And so we were constantly trying to see, as well as deal with the short and medium term, what was coming down the line. And again, given this point about national stamina, when the vaccine was credibly likely to come in, or plausibly likely to come in, and therefore Chris and others and Patrick would update us on how the trials were going. And that itself was fascinating. I learned a huge amount from them on that, and indeed that process. And I think sometimes we wanted some good news, and progress on the trials was clearly of that order. I don't think I was saying that it would come quickly enough to prevent the December restrictions.
Yeah. And then if we look a little bit further down in the same paragraph, you say this: there was a strong view that we could not get into a series of rolling lockdowns, but rather had to wait and impose any further lockdown, not in order to stop the virus, but to flatten the curve when that became necessary to protect the NHS again. And you say in order for the vaccines to become available. Well, we've heard that there were certainly, putting it at that level, two options. One was to have a series of what would be smaller lockdowns, which would keep incidence in the population low. The other was to wait until you had to have a lockdown in order to save the NHS. But that would mean various things. One thing would mean that the lockdown, when it came, would have to be more severe and longer. And the other, of course, would be that incidence in the population would rise in the meantime, which would mean more people dying, more people contracting long COVID, and so on. So looking down at paragraph 159, you say the idea of a circuit breaker was politically expedient and easy to communicate, but we did not consider it was likely to be the best timing or most effective. So one understands that there are trade-offs, of course, as in any political decision, but what was the trade-off then between a circuit breaker and waiting until your hand was forced in order to save the NHS?
I think the thing I had on my mind is the fatigue that was setting in with lockdowns or analogous restrictions to lockdowns, and being in and out, I think, as well as being physically, logistically, is emotionally exhausting for the country, plus the impact on business. So I'm looking at it in the round, and I'm, whatever the, and I think my view was based on the evidence that we were getting. I think at that point, it was really about just trying to protect the NHS, because the lockdowns aren't going to make COVID go away. The thing we need is the vaccine. And we've discussed that there were signs, but obviously nowhere near fruition yet of that coming in a positive way. And just trying to deal with the national exhaustion of lockdown and what it was meaning.
Mr. Raab, you talk about national exhaustion. There's also the question of mortality and the national number of people who are dying. And the circuit breaker, we've heard plenty of scientific evidence, would have kept the incidence of COVID at a lower level, which would have meant fewer people dying. Was that something that was considered at the time?
Yeah, absolutely. But and again, we relied on the evidence as we had it at the time. But of course, we were mindful of that. But you've got your four key things which you're constantly focused on: the COVID deaths, the non-COVID health impacts. People would also have their lives and their health at risk if we can't get the NHS working. We've got the social impact, the economic impact as well. Social impact isn't some sort of fluffy, abstract, amorphous thing out there. It's the impact on the mental health impact and all the other impacts of those restrictions. And the challenge is to look at those in the round and take a balanced decision. So when the idea of going in and out of these circuit breakers, I think was actually, even if you could make a rational argument for it, I think bearing in mind the likely compliance, And if it was tiered measures in particular, the difficulty of policing and enforcing that, coupled with the fact that people's stamina for it is fraying, I think that's why I took the view on balance that I did.
We've seen evidence of all the briefings that the Prime Minister had in the days running up to this decision. There's actually very little in your witness statement covering that period. Can you help us? Were you involved in those sort of daily meetings for the week or two before the 31st of August or not?
From the recollection, I can't remember. I mean, obviously, the most intensive period was during the Prime Minister's absence. There was then periods after that where I was brought in to do deep dives, and I think partly because of the experience and the trust that I had with the Prime Minister after that situation, the development of the First Secretary role, it developed further, but I can't remember off the top of my head quite how involved I was in some of those detailed meetings.
Thank you very much, Mr. Rubb. Those are all my questions for you.
Thank you.
Thank you, Mr. O'Connor. Miss Heaven. I don't know if you... Miss Heaven's over there, but if you look to the right of the pillar, Mr. Rubb, she'll wave at you in a second when she's...
Okay.
Good afternoon, Mr. Rubb.
Good afternoon.
Over here. I asked questions on behalf of the Covid-19 bereaved families for Justice Cymru, so it's a slightly Welsh perspective now, please. Just have a very few questions for you. It really starts with paragraph 228 of your witness statement, and it's no criticism of you, but I think that's really the brief explanation you give that touches on DAs. So I'll just read it out just to remind you. I think you've got it there on screen. In my experience, the arrangements for interaction and joint decision-making between the UK government and the devolved administrations worked reasonably well. I did find that it became irritating as the pandemic went on that Scotland and Wales wanted to do things slightly differently or with different timings for what appeared to be political reasons. But we had regular meetings for the DAs and they were included in the COBRA process. Generally speaking, we did take the DAs with us on key decisions. In any event, the differences were fairly minor. In the end, staying in lockdown slightly longer, for instance. So before I come on to my question, just in terms of your involvement with the DAs, clearly you've got lots of other things that you're doing at various points. I think you're attending some COBRAs, but clearly not all COBRAs. Is that fair?
Yes.
And are you attending the Four Nations meetings with Mr. Gove? I don't think we see you really in those meetings. Is that fair?
Not all of them.
No. Okay. So just focusing on what you say about this joint decision-making and it working reasonably well, and obviously you've referenced there COBRA, you may be aware the evidence given to the inquiry by the First Minister for Wales, Mr Drakeford, and indeed by some of the other First Ministers in writing, is that in their view there was in fact no joint decision-making forum involving the devolved administrations. And what they say from their perspective is COBRA was not really a forum in which the DAs could feed into UK decision-making, not least because they had no control over it. When it met, they didn't get the papers until the last minute. And of course, as we know, COBRA didn't meet, I think, between 10th of May and 22nd of September for 2021. So just thinking about it now, is that not a fair comment then from the First Ministers on this issue of joint decision-making, certainly in respect of what was happening in 2021?
So first of all, may I just say how my heart goes out to all the bereaved of Wales, as it does all the other parts of the UK. In terms of paragraph 228, I mean, actually, I think the operation, both of the devolved administrations and the relationship, how they interact with the UK government, work tolerably well. Yeah. There'll always be different views about how much should be centralised and how much should be decentralised. I think that the DAs were fully locked in. I think Michael Gove was tasked with that. I thought he did it very depthly. And I remember countless meetings where we were all there, not just the devolved administrations, but also the Mayor of London, and they all had the opportunity to feed in, and they did. So I can understand where I missed all of the focus on the operational function of getting through the pandemic, whether it's from Wales' perspective, a Scottish perspective, or a whole UK perspective. Most of the time, I think in good faith spent on that. I think there's always an element of politics between the DAs and Westminster. I think it was kept to a tolerable limit. I think the one thing it really showed up, though, if I may say so, is the value of the United Kingdom when it comes together, whether it's PPE procurement, whether it's test and trace, whether it's the rollout of the vaccine, how we perform as a team. And I think that was the most important lesson for the United Kingdom and for all the DAs.
Okay. Well, I'm going to try and keep you on topic because it is joint decision making. But just briefly, though, I did reference COBRA not meeting 10th of May to the 22nd of September. Not having a COBRA for 4 months, that can't possibly have helped integrate UK decision making at that high level. Thinking of Prime Minister meeting the First Ministers, it can't possibly have helped, can it?
Well, as I said, the Michael Gove, I think, at what I would describe as a working and operational level, was constantly locked in. I don't know, were there requests made for a COBRA that were denied? I wasn't aware of any. But in any event, often when at operational level things are working smooth, you do need fewer of the very higher level meetings. Why? Because actually you've got a good working relationship and some of the creases are being ironed out in a constructive way.
I'll come on then to the next topic, which is, as you've just raised it there, whether there was a concern about high-level meetings. And again, just to put it to you to get your perspective, Mr Drakeford has, again, raised in his evidence, and of course we do see it in the documents before this inquiry, that he had concerns, and I think there were also concerns from the other First Ministers, about an absence of regular meetings between the Prime Minister and the First Ministers of Wales, Scotland and Northern Ireland. And indeed, he says, in his perspective, it did undermine the Four Nations approach to the response to Covid-19. So just in terms of your state of knowledge then at the time, were you aware that these concerns were held and being expressed by the First Ministers, that they were unhappy about the level of regular access they had to the Prime Minister? So were you aware at the time that this was a concern being raised?
No, I don't think so. Not in those terms, no.
Okay. Well, indeed, in any terms, is this something that you had heard about?
Because the natural order of things in terms of the relationship between Westminster, Whitehall and the DAs, that there will be various offers and asks and gripes and groans both ways. So there's not a sort of perfect harmony, particularly not during crisis. But actually, what I think beneath that and beneath the political dimension of that, actually the working level relationship, I think was very resilient. And as I said, and I'm not trying to circumvent, I'm trying to address squarely, the whole point about the teamwork that's required is that the combination of what the DAs do, what the UK does and what we do together was actually pretty effective. And I've given you 3 concrete examples where I think that's borne out on the evidence.
Okay. I'll move on then to the next topic. And this is the other issue you raise in that paragraph that I've read out to you from your witness statement. And it's the bit where you say you found it irritating that as the pandemic went on, Scotland and Wales wanted to do things slightly differently or with different timings for what appeared to be political reasons. Obviously, I'm not asking about Scotland. I'll let others do that. I'm just focusing on Wales. So in terms of lockdowns, you'll be aware that the Welsh autumn firebreak started on the 23rd of October 2020, whereas England's second national lockdown started on the 5th of November 2020. So is the fact that Wales went into that autumn lockdown sooner in 2020 something that irritated yourself and the Welsh Government at the time, so that they got in there quicker, effectively?
Oh, no, I don't think I would give that as the particular example.
Okay, that's the example. Okay, so can you identify then what is the example that you're alluding to there in the paragraph of Welsh Government decision-making which diverged from the UK decision-making which you found irritating?
I think in general, my sense was, and I'd need to go back over the various different meetings and try and decipher is that there was perfectly good arguments sometimes why they might go a bit slower or a bit quicker, or why they wanted something that they hadn't yet had. Again, I thought Michael Gove and the Prime Minister were very good at trying to reconcile whatever the barrier to that happening was. Sometimes it just felt like, for the sake of doing something out of kilter with the UK government, that there was a political gain in doing so. But as I said, the differences were fairly minor, and I didn't attach huge importance to it. But I think if you think that the Plaid Cymru or the SNP or whoever else were totally absent of political thinking during that process, I think there'd be an element of naivety, if I may say.
But if I can just press you a bit more, though, is it the case then that you're not able now to give us a single example?
I didn't in the statement. I was asked for my view about how things worked. I'm not trying to stir up those tensions. I'm just giving you my impression, holistically, that there were, at times, a sense that one or other of the DAs wanted to get the jump for political purposes rather than because actually there was a particularly compelling case.
Okay. Well, thank you very much, Milady. Those are my questions.
Thank you, Ms. Heaven. Very grateful. Mr. Dale, do I understand your... Mr. Dale's over there. Are you going to come? Are you going to stay there, Mr. Dale? Don't worry, he's used to backs. I'm afraid, Mr. Davis.
I will turn and give my evidence to the inquiry.
Very well. Thank you, my lady. Mr. Robb, I ask questions on behalf of the Federation of Ethnic Minority Healthcare Organizations, or FEMO. And I have a handful of questions largely related to the period in April 2020 when you deputized as Prime Minister while Mr. Johnson was hospitalized with COVID. Let me begin with hopefully some useful context. The period of the 2nd to the 10th of April 2020 is considered by those I represent as an inflection point for addressing disproportionate COVID-19 deaths in Black, Asian, and minority ethnic community for two reasons. One, on the 2nd of April, Professor Conti, whom this inquiry has already heard from, made an intervention to the CMO, Sir Chris Whitty, about what he referred to as signals of disproportionate impact on Black, Asian, and minority ethnic community, for which Sir Chris responded by email on the 4th of April. And secondly, a Guardian article of the 10th of April noted that the first 10 doctors to die from COVID-19 were of Black, Asian, and minority ethnic origin. In your own witness statement, you say at paragraph 212, found at page 62, and I quote, "We did not have much learning at the early stage on the variable impact of COVID on ethnic minorities." So with this contextual background, here are my questions. Firstly, in the absence of the Prime Minister between the 5th and the 25th of April during his hospitalization, were you specifically called on to address the matter of disproportionate death rates within Black, Asian, and minority ethnic community?
Specifically by who?
By your advisors or anyone?
No, not specifically in that way. I was, as I'm sure everyone in Cabinet and in government was mindful of some of this data and evidence coming through. The reality was and we had quite a few conversations with the chief scientific officers and Chris Whitty and others, and I think even by that point, it just, the data and the evidence was too fluid for us to be able to come to any definitive conclusions, let alone actionable policy making. And therefore, we were mindful that there was some clearly more examination of this that was required. And I remember asking to be involved in those discussions. But we just didn't have firm enough conclusions, and the science wasn't firm enough to be able to take it forward.
If I could just push you a little bit for a simple clarification on that. And my question would be this. How did this issue come to your attention in real time?
Well, I think we could read things like the news reporting. I think because of some of the emerging data, it would have either been raised proactively by the CMO or the CSA or by ministers in any one of the meetings that we were involved in.
And you might have adverted to it in your earlier answer, but can I ask you, what was your understanding of this particular phenomenon? What for example, was your view of what was driving these outcomes?
It wasn't clear. I think the one thing I was mindful of is the importance of being able to disaggregate data in a way which doesn't lead you up it doesn't give you a false lead. But to be honest with you, what I thought my role, and I often do this, particularly outside the area of being Foreign Secretary at that time, which is obviously my portfolio, is to try and test and challenge. I think we did do quite a lot of that on this. And so it wasn't the absence of asking the question. I just don't think that the evidence had firmed up with the kind of, to use the inquiry's terminology, consensus view of SAGE or otherwise. So sure, there were evidential leads that were emerging, all of which required proper examination. But did that lead to clear consensus? Well, not to my knowledge from the CMO or SAGE.
And from that answer, I presume that there were conversations that were ongoing about this issue. Who were you speaking to? And I perhaps mean that in the sense of whether you were speaking to people who were scientific or public health experts or political experts or both.
All of the above. And it would typically arise as a classic issue that came up in the context of the COVID meetings, the COBRA meetings, or indeed in cabinet, where we were conscious that there was this issue there on which we had incomplete knowledge, but we felt was very salient and clearly very serious. And that's the way it tended to emerge. Someone would ask a question, but what about this? And inevitably, the evidence would come back from the scientists that we're not clear yet on the firmness of the evidence, and therefore it's difficult to decide what your political or policy answer is going to be. Until you've got the evidence about what exactly is happening, why the disproportionate outcomes to one or other element of your society, I think it is difficult to come up with a definitive policy which doesn't risk being counterproductive. And I think quite a lot of us, we talked about with our four core priorities, there is an element of nervousness about the negative implications of one or other course of action. When the evidence basis is not that firm or hasn't firmed up yet enough, I think those concerns and that uncertainty is even greater.
Can I ask, what, if any, contemporaneous strategic response was pursued regarding this issue?
With respect, sir, I think I've answered that, which is that I think it was very difficult to come up with a strategic response in the absence of firm evidence. And the risk would have been you would have got your strategy wrong if your evidence base wasn't firm enough.
So I take it that is a wait and see.
Well, we're always desperate to get more evidence and then respond to it as it firmed up and as we had a clearer idea of what the implications were and indeed the implications of the various policy options.
You state at paragraph 212 of your witness statement, which I referred to earlier, that, quote, what was clear was that schooling would be impacted by lockdown and particularly significant effects on poorer children and those from ethnic minorities. Why was it clear to you that there would be a significant impact on poorer children and those from ethnic minority backgrounds?
And you're citing for 211?
212.
212. Yeah, but look, I think in all of this, and I've at various points questioned, in this kind of scenario, a box tick exercise I think is very difficult to decipher what I think ought to be the overriding issue, which is vulnerability. I felt, and I think I still feel, though again, always happy to reassess the evidence that we have today, that the two bits of our sections of our cohorts of our society most dramatically affected by lockdown were children, if we locked down schools, and the impact on the elderly from the measures that we were taking, whether it was to lock down or not to lock down. And if we did lock down, then you've got safeguarding and the perennial issues around that. In relation to children, the more disproportionate impact will be on children from deprived backgrounds, and it's just, I think, a sad fact, that will include disproportionate number of black and ethnic minority children, and so that's not based on some standalone evidence in relation to black or ethnic minority children. It's in relation to children, middle class or well-off children, I think it's fair to say, and with families that can deal with the homeschooling or the schooling by Zoom or by Teams, I think would lose out less, although everyone lost out, than those from more deprived backgrounds where dealing with those kind of remote learning challenges will be less easy. That's the reflection I have.
This inquiry has heard a fair amount of expert evidence, including from Sir Patrick Vallance, that disparities in health outcomes from the pandemic were, and I quote, entirely foreseeable. This would tend to support your observations about the impact of lockdown on poorer children and those from ethnic minority backgrounds. How then do you reconcile this understanding with what you say earlier in the same paragraph, that's paragraph 212, where you say that you did not have much learning on the variable impact of COVID on those from ethnic minority backgrounds?
Well, at the time we didn't. So Patrick may say we do now. Of course, that's the point of this inquiry, and I think learning lessons and as the evidence evolves, because of course we have a huge evidence basis coming out of the pandemic, but at the material time at which these decisions were making, I think that's correct.
Very well. Those are my questions.
Thank you, Mr.
Thank
Dale.
you,
Ms. Davis. I understand you're going to cover one point that you thought Council was going to cover, Council of the Inquiry was going to cover.
My lady, you've given permission for that, so thank you very much, and I will do it within the time allocated. Mr. Raab, I'm asking questions on. Can you see and hear me? Yes. I'm asking questions on behalf of Southall Black Sisters and Solace Women's Aid, who you will know are part of the violence against women and girls sector and concerned with domestic abuse. So I have three topics, as my lady has kindly said. The first is about equality impact assessments. You say at paragraph 210 that those were carried out by the civil service, but you thought they were a fairly blunt tool. You're not a huge fan.
Yeah, that's probably a reasonable. I mean, I think it's an important objective, of course, to see the disproportionate impact on members of our society or specific communities of measures we're taking, or indeed the pandemic as a whole. Whether the EIAs discharge that effectively, I think, is a moot point. So
a useful tool, but maybe not carried out effectively.
Well, whether it's a
useful function, I should have said.
I think a useful aim. Whether the EIA is the right tool as currently focused, I don't know.
And just to take one example, and you may say, well, you have no recollection of this, but in your witness statement, you're talking about one meeting that you chaired, which was a deep dive on the 29th of April. It's paragraph 188, and it's looking forward to the end of lockdown and possible measures to be introduced at the border to reduce risk of imported cases coming in. And 4 recommendations emerge, and the 4th one is a requirement for arrivals to self-isolate for 14 days, either at home or in hotels. Can you remember whether that deep dive was accompanied by an equality impact assessment and whether there was any consideration of the possibility of domestic abuse emerging if couples are self-isolating for 14 days?
I can't, in relation to that particular deep dive. We were certainly, I certainly remember and reflected on the fact that the lockdowns had a varying effect on, if I can put it this way, family harmony. You had quite a few people, if I could say this, typically middle-class families, and I heard a lot of this in my own constituency, so for whom lockdown was an epiphany moment because they spent more time as a family. Now, there are all sorts of challenges and hardships, of course, but there was something rather positive about that. I think there were also, and we were very conscious, be other communities and households and other parts of the country where the experience was that actually the combustible nature of what was going on in the home, whether it's because of mental health challenges or whether it was because of domestic tensions and domestic abuse, where that was very different. Quite whether an EIA would have picked that up and what would it have told us that we could have done about it, I think is another question. But I don't remember, forgive me, on that specific deep dive of the 29th of April, quite what the EIA said, or indeed if it was conducted.
Thank you. And of course, I'm sure you didn't mean to imply this, but domestic abuse happens in middle-class families as well as non-middle-class families.
Oh, sure. I'm just, look, and in fact in Surrey, we've got very, very high levels of domestic abuse. So I don't think it follows class or even wealth. My reflection is just that I think intuitively and impressionistically, but I suspect the data backs it up, there are two diverse experiences of lockdown, both of which were quite salient. Some families where there was a very positive dynamic, for whatever reason, people took a moment to think, well, actually, I want to spend more time with the family, and maybe I was working too hard. We can see this, by the way.
If you don't mind, I've got very limited time.
Well, you did put it to me that I was somehow...
So it's because of me, Mr. Robb, I'm afraid I've imposed strict time.
I think we have the point that families have different experiences in lockdown.
Very good.
Thank you. Moving on to my next topic, and that's about non-shielding vulnerable groups. And you had quite some involvement in considering what was called non-shielding vulnerable groups, so they're not clinically vulnerable. You chaired a meeting on the 24th of April, 3 days before the Prime Minister returned to work, and that was a COVID MIG on the non-shielded vulnerable groups. I don't need to take, I know I can see you're looking for papers, I don't need to take you to the papers. Simon Case presented on non-shielding vulnerable groups, and one of those groups was those experiencing domestic abuse, and he said that was amongst the highest risk of government failing to meet needs, and described that risk as acute. So the MIG took that very seriously. We know that MIGs were abolished and replaced with COVID-O and COVID-S. Are you able to say whether or not that work stream, headed up by Simon Case on domestic abuse, moved over to the COVID-O, COVID-S structure, or whether it was lost or disrupted in some way?
Forgive me, I have no idea. It wasn't either direct personal responsibility, and of course Simon Case was very professional, so I think I would have assumed that that would have been continued through.
Right. And my third additional question is this, and again it's about the period when you're acting Prime Minister, and it is the, forgive me, I just have to get this on my screen, it is the 16th of April, and you are addressing the nation in very sombre terms, and your address to the nation is about the decision that had been made, I think, earlier that day, that the lockdown would continue for another 3 weeks. In other words, it wouldn't end early. And you make it very clear what a significant decision that was. You end your speech with, please stay at home, save lives and protect the NHS, the government slogan. Some 5 days earlier, the 11th of April, The Home Office had launched its You Are Not Alone campaign. Dame Priti Patel had done the daily press briefing, and she'd made a point of encouraging domestic abuse victims to know that they could leave home under the regulations if they needed to escape, in risk of injury, risk of harm. Your speech doesn't contain that information, that those who are suffering domestic abuse or think they're going to suffer domestic abuse or any other sort of injury could leave home. Do you think that it should have included that message?
Was this at the press conference?
It was the I think the address to the nation, the daily press conference. Yes, but it was one of the very significant ones, because you're saying lockdown will continue for 3 weeks.
Look, inevitably, you have a very limited period of time, because actually those press conferences were also supposed to be about taking questions, not just talking to the public. So inevitably, we couldn't contain every caveat to the headline advice. It just wasn't manageable. I thought the Home Secretary had really spelt it out very clearly. We felt we'd landed that message. Of course, you would always want to reinforce it, but there was probably a whole range of things where if I'd have gone down and itemised every element of the advice, we would have been there for a disproportionate period of time, and that wouldn't have served the purpose of the press conference and landing the messages, because I think people would have drifted off, frankly, and that was our experience if those became too unwieldy. So it wasn't, I think we did land that message, and I think we continued it in our comms more generally, and it's certainly because it wasn't in every press conference, or indeed that particular one, didn't, I don't think it's fair to read into that a deprioritisation or it being of lower level of importance.
In hindsight, do you think that might have been an immensely welcome message for someone sitting at home watching you, who was experiencing domestic abuse or thought that she might soon, and was hearing that there would be another 3 weeks of lockdown?
Look, I think with all of those groups that suffered disproportionately, you can always look back and think, well, I wish I'd have said a bit more. But in the end, we only had a limited space within which to craft our message and deliver it. And that was true at a whole range of points. You inevitably have to editorialise your message. But certainly we were very mindful throughout that there was this, if you like, simmering issue of domestic abuse, and that lockdown was clearly making it worse. And we wanted to try and make sure that the lines of communication practically were there for anyone that needed that critical help.
Thank you very much. My lady, thank you very much.
Thank you very much, Ms Davis. If you look straight ahead, Mr Robb, last furlong, Miss Mitchell.
Mr Rabb, I appear as instructed by Amar Anwar and Company on behalf of the Scottish COVID bereaved. I'd like to take you back to the paragraph that my learned friend from Wales has already taken you to, that being paragraph 228 of your statement, and that's coming up on screen for you now. My learned friend covered, at least from Wales' perspective, the issue of your irritation, and I have you noted as explaining in your response that there were perfectly good arguments sometimes why they, presumably the devolved administrations, might go a bit slower or a bit quicker, or why they wanted something that they hadn't yet had. But you also say sometimes it just felt like, for the sake of doing something out of kilter with the UK government, that there was a political gain in doing so. And then you go on to say that you thought the differences were relatively minor in any event. Now, I'd like to ask you about that, particularly focusing on the issue of your irritation. You have described yourself as a recovering lawyer, and you'll know the benefit of basing your views on concrete evidence. So my question to you is this: why are you irritated on the basis that sometimes you just felt like it was political, when you don't actually have evidence to support that, but you do, by your own words, have evidence to support the idea that perfectly good arguments have been made as to why things could go faster or slower in Scotland or Wales?
So, look, if I'd have had advance notice, I would have pored over the documents and come with a good example for Wales and a good example for Scotland. Forgive me, but we're talking about matters that were a long time ago. And also, I'm not trying to needle either Plaid Cymru or the SNP. But the truth is, the answer to your question is there's often a combination of reasons. Some were more compelling or persuasive on the facts than others.
Indeed, but you weren't present at, for example, meetings with Scottish CMO when the decisions were being taken in Scotland. So my question is, why are you ascribing the idea that it's political instead of the idea that it might simply be, as you've said, a reasonable decision to take?
Well, because I was in a whole range of meetings with First Ministers or other ministers from the devolved administrations, whether it's Welsh or Scottish, and I also could see the grounds or the reasons, whether it was on the papers or as explained by them, for the decisions, and that was the view I took.
I'd like to move on to paragraph 229, if we can have that up on the screen, please. And you described what you've already mentioned about the benefits of matters being centralised and reserved to Westminster. And what you've said 3 lines down is, however, any taking back of powers would be politically controversial, so there should be a very high threshold for doing so, and I would need to be persuaded that there was a demonstrably significant gain in efficacy. As a result of my experience during COVID, I was not so persuaded. So I would like to ask you 2 questions in that, interrelated. The first being, why were you not so persuaded? And the second being, what do you consider the threshold for Westminster taking back powers from the devolved administrations to be? So I wonder if I can ask for your comment on the first question, please.
Yeah, I mean, to be clear, I'm making the case that, on balance, for those that think we should become more centralised, I'm not persuaded of the case. I think if you did want to do that and you wanted to make that case and you wanted to pass it with the consent of the devolved administrations or one or other of them, I think the bar would have to be quite high, given A, the legislative requirements for doing so, and B, frankly, just common political common sense. My overriding experience is that actually Team UK work very well together, and because of the United Kingdom-wide government working with the devolved administrations on those 3 critical areas, test and trace, PPE procurement and vaccine rollout, actually we work very effectively together. It's a good example of the UK delivering for the people of Scotland, or indeed the people of Wales.
Mr Rabb, we've heard, therefore, that you weren't persuaded that, as a result of your experience during COVID, that the threshold had been reached for, as you've described it, taking back any taking back of powers. The second part of my question, and I shall remind you of it, is what do you consider the threshold for Westminster taking back powers to be?
High.
Is that your only identification?
Given that I'm not in favour of it, I'm just making the point that for those that are making the case, I think the basis would be pretty high, whether it was because the legislative or the political common sense would be that frankly, I think that most people with a political antennae would know you'd want to have the Scottish people with you. You'd want to be able to make the overwhelming case that they would be better. I'm not sure for such a controversial step that case has been made. And as I said, quite how I define high. I haven't dwelt on this at any great length, but I think the case for unpicking the current devolved settlement, I think you've got to be very careful what you wish for. And I think the case for re-centralising power has not been made.
I wonder if we can then move on to paragraph 230 of your statement. I don't need that to be brought up online, but it said, you said there that there were benefits to the devolved approach, as it meant Scotland and Wales were required to face up to the same difficult decisions those of us in Westminster had to, and work with Westminster on them. Other than political considerations, do you consider there to be any benefits to the devolved approach in the pandemic?
Yeah, I think the critical one is accountability. So to the, I mean, in an emergency, and you look at, for example, other countries around the world, and people would comment that, for example, test and trace or whatever else was done more effectively in some of the East Asian countries, but they have a much more centralised, frankly, more authoritarian approach often. I'm not for a second suggesting, indeed, I think you have to take that into account as to why in a Western liberal democracy and a European one, you wouldn't be able to do that. I think that there are obviously areas where if you can devolve things locally, that's valued, and that's in normal times. In a crisis, it's slightly different because you want this more decisive action. But actually, I think what I'm saying is overall, net of all of those considerations, I think it worked out quite well. And one of the positives, if, for example, there is any naked politicking, there's going to have to be accountability for it. And that's the natural course of a devolved settlement. There will be local accountability for local decision making.
So you've identified accountability, but what I'm asking is, was there any actual benefit in respect of what happened during the pandemic?
I'm not averse to that thesis, that argument. I'd need to reflect on it. I haven't thought about whether or how the devolved settlements actually helped the Scottish or Welsh administrations deal more effectively than if it all had been centralised. But I can see how that could be the case, particularly, for example, where you're dealing with local authorities or potentially care homes. Although, again, it depends whether you're talking about judging it by results or judging it by theoretical powers. But I'm not in the business of criticising the DAs. I'm in the business of working with them as effectively as possible.
My lady, those are my questions.
Thank you very much, Ms Mitchell. I should just say, Mr Robb, before I have Mr Drakeford on the phone, that I think you twice referred to High Cymru as being, and the government in Wales, it's a Labour government, I think.
Of course.
I just didn't want anyone getting upset that we didn't understand.
Is
that it?
I have nothing further.
Thank you very much indeed, Mr Robb. I'm sorry we've kept you here for so long, but we have now completed your evidence and I'm very grateful for your help.
Very good, thank you.
And it's 10 o'clock tomorrow? 10 o'clock tomorrow, please.
All rise.